Good morning, everyone. Thank you for coming today. We know we're a little weather challenged. There's lots of other challenges that I will not mention. And we're just excited to see the room fairly full, and we just want you to have a great experience today. I'm Cheryl Larson. I lead the Midwest Business Group on Health. I am very excited to have some of my sibling coalitions in the room, and I'll do shout outs later to them and their employer members. We're actually conducting a PCORI event here tomorrow in this room. So they came a day early. We're excited to have them join us. And I'd like to get started with just a little bit of information about MBGH, and then I'll introduce our opening keynote. We have been around for 46 years as of this past January. We represent around 5 million. It says 4 million plus, but it's around 5 million lives. We have over 170 employers that are mid, large, and jumbo. They spend a lot of money on healthcare every single year. We see ourselves as a community of peers and a trusted source. And that's what we coalitions do in this country. We represent the human resource and health benefits professionals from mostly self-insured public and private employers. We also offer, everything we do is for our employer members, although we do have partner members that we love. We offer monthly educational programs, employer-only roundtables, employer advisory boards for projects on various topics. We have our 2.5-day big annual conference. If you're interested in getting on our mailing list, you can go to mbgh.org. We also work with the National Alliance of Healthcare Coalitions, which is an organization that represents a lot of the coalitions across the country. We do a Pulse of the Purchaser survey with them every year. I may have some slides in here, but you can also get some information on the homepage of our website. Employer Connect is our online platform. A lot of our members will have an important benefits question or something that they need to know about a vendor, and they can use that tool to get an answer very quickly. We launched 2 new already this year employer action briefs, and we make these available to any employer in the country. Just go to our website. Under resources, these 2 are already on the rotating banner when you land on the homepage. The first one is employer provider direct contracting with a focus on COEs. And I believe that direct contracting is the future of healthcare for employers. It's not the only cog in the wheel, it's an important cog in the wheel. And this is a pretty comprehensive overview of what the options are and what employers are doing and what questions to ask potential vendors. And then the other one was launched, I think, last week. GLP-1s, everything, 14 pages. It was supposed to be 4, I'm just going to tell you. Really comprehensive. It talks about our employer experience. All of these always have MBGH employer member quotes in them to help you really understand, that you're not going through this alone. Our brand new GLP-1 survey results are included in that in one of those buttons on the far bottom right. So take a look. Here are the links right here. We also have a purchasing arm. Now, many of our sister coalitions have purchasing arms that are a big driver of support for employers and revenue. Ours has always been relatively strong because a lot of our employer members wanted to make those decisions on their own. But in the last few years, since Mark Flager and the team have worked heavily on finding the right partners, we have expanded that significantly, and we're really excited about the future. You can see the partners at the bottom. We are actually, I'm going to go back for a second. We're actually going to expand that number of vendors. We are in the process of looking at finalists for 2 transparent PBMs, one that'll be focused on cost and value, and one that will be focused on cost, value, and the patient experience. We also have another, in addition to Health Strategy, which is a pharmacy benefits consulting firm that helps to optimize your PBM contract. We have another organization joining us that will focus on the mid-sized market and all sized employers. And then down the road, we've got some folks we're looking at for fraud, waste, and abuse services, for data analytics, et cetera. Our 2 remaining big educational events for the year. June 24th, our employer forum on pharmacy benefits, specialty, and drugs. And the two main topics of that will be price transparency in the PBM space and high-cost therapies, high-cost claims. We've been working heavily on, through our National Employer Initiative, on pharmacy benefits, specialty drugs, cell and gene therapies, and I know it's long. We're working on it. But we've been working on that heavily in the last, 5 years. It's a 16-year-old project. But we felt that with the new legislation that came through on PBMs and a lot of other challenges and opportunities taking place for employers, we needed to look at those areas. September 30th, again, transparency pops up, data access, fiduciary duty, and lost dollars. Tomorrow in this room, as I said, we have a PCORI national convening, and this is an employer member only invitation. We're looking at evidence-based behavioral health, and you're going to hear from Dr. David. And David, what's your last name again? Thank you, David Kraus, shout out. He will be on a panel with myself and one of the clinicians at CureLink to talk about the marketplace and what research is happening and what's working and what's not. But we would love to have you join us tomorrow. If you're an employer and you're available and you're not signed up, just talk to one of our staff. We also have done a few things with our colleagues and sister organizations recently. The Economic Alliance of Michigan, our sister coalition in the state of Michigan, located in Detroit, did an educational series on using healthcare claims data. We had that, I think, February. And for those of you in the room that are members, the recording is still available. It's the same woman, Chris Deacon, who's going to be the keynote at our annual conference. She has a new book out. It is absolutely fantastic. It's probably scary nighttime reading because it's about healthcare. But we're gonna come up with some solutions with her at our annual conference in May. There are 3 more additional sessions. MBGH is going to work with EAM to produce that last one in the fall. If you're a member, this doesn't cost you anything. Please join. Pulse of the Purchaser Research Initiative. Again, National Alliance has this great resource for employers. If you haven't signed up or not aware of it, take a look at it, use the QR code, ask me or a staff member. It's an opportunity for you to use your employer story, feedback, knowledge to support employers across the country. I see someone taking a picture of the QR code. I'm going, yeah, you did it. Our 46th annual conference, we are so excited. I just want to remind you, it's an employer blueprint to unite, demand, disrupt, and repeat. Because we're going to have to keep repeating what we're doing because we need to get our voice out there. Join us on May 4th as an employer for the employer pre-conference. We're going to do a workshop on high-cost claims, take a tour on a boat, look at the architecture in Chicago, which is phenomenal, and then a nice dinner. And just a quick reminder, every single employer member of MBGH receives 1 full complimentary pass to the conference. And we haven't added it yet, but any additional registrations for you as an employer from the same company will be half off. And it's still not a lot of money to attend these for a 2.5-day event. Here are our keynotes. I already talked about Chris Deacon, Cora Upsall, who is phenomenal, who's going to talk about medical and pharmacy contracting, and Ford Coles, the advisory board. Fantastic speakers, very open, honest, and disruptive. What is today's program about? Do me a favor, silence your device. Please ask questions. Use the chat function for those of you who are on the phone. How many people do we have on the phone today, folks? We're going to let you know. 90. Well, that 90 would have been better, but that's okay. Shout out to those of you on the phone. Thanks for being part of it. Here you'll see your Wi-Fi information, and we do have a short survey at the end, so spend literally 1 to 2 minutes filling that out. We really pay attention to that. HRCI accreditation, which also includes SHRM now. I think it says at the bottom, Sherman-Siebes credit. So let us know if you need any help with that. All right, if you haven't logged into the mobile app, here's the QR code. And the mobile app has all of the bios and agenda and information about our sponsors and MBGH and most importantly for right now, there's a link on there for polling. It's literally like it says polling. We're going to be doing polling today. We love to do polling questions. So as I walk you through this very quickly, search for MPGH events if you are using the QR code, download it. If you're signed in, great. If you're not, sign in. You can see the instructions here. Does anyone need help? Raise your hand, because I always need help with this stuff. We are here to help. Okay, good news. All right, for the polling questions, you all get to participate. Here are instructions again. If you don't see it, click more at the bottom right, select the March event, answer the polling question and scroll down. All right, here's our sample question. What helps you reset after a demanding day? Examples might be walking the dog, taking a long bath. Go ahead and let us know. I think we only, it's not a, it's, oh, it is an open-ended because we're going to do a word cloud. I love cats. How many of you have your cat walk into your frame when you're on Zoom? I do. Dance break. We had a dance break we had a couple dance breaks at our January program, didn't we, Paula? We had one of our keynotes who got up here and danced, and she made everybody stand up. And as you can imagine, a bunch of, benefits people. I thank you for laughing, Paula. Okay. Oh, this is great. This is great. Playing cello. Wow. Chocolate, vacuuming. Come on over, whoever said that. I love this. Crafting. Martini. Saw that. Where's the wine? Rebecca, put wine in there. I'm kidding. Well, thank you for participating. Baby snuggles. All of these are fantastic. Mark will take a picture. We'll probably post it. I love it. So I want to thank our sponsors. Always grateful. This is always a very popular program. CuraLink is going to be on a clinical panel with us today. Thank you, Lily, for dinner last night. That was fantastic. And we've got 3 exhibitors that are in the other room. And there are a few other organizations in there that are tied to our speakers that we ask them to please come and bring information. So go visit all of those. Now, we know we give out prizes. If you haven't been at one of our events, our prizes are fantastic. Sometimes we have 20 of them. Today, we have quite a few. Virtual participants are encouraged to participate by engaging twice during the call, whether you're asking a question or making a comment. That would be fantastic. Our prizes are right here. We're going to need you to get your, to turn in your completed card to the registration desk by 2:05, and then you have to be present to win. Here again are the prizes. Okay, I'm going to get started. I wanted to share with you some recent research from IBI. How many of you know who Integrated Benefits Institute is? So that's a great number. They do phenomenal employer work. They use employer data and data from other sources to really, really drill down on various areas. And I just want to share these 5 pearls, if you will. Mental health is the most expensive disability claim category. I did not know that. It accounts for only 9.9% of claims, but drives 12.3% of all payments. 4.2 convert to long-term disability. Recovery rates rival other major conditions. The longer a leave continues, the harder the return becomes, and younger workers and women are most impacted. And I actually had one of our new board members come up to me last night and ask me about what's out there for children in the mental health space. We didn't have a direct answer for her. We had a little, this vendor does this, or we're moving into this kind of area. If any of you have any ideas on mental health for children, because oftentimes they don't qualify until they're 13 or a certain age, please come see us. We would really like to know. We know we're in a mental health crisis today, and our children matter the most. Here's an infographic that you can probably get access to as well. I am thrilled, after meeting our opening keynote last night, Chase Sterling, to introduce her. We have a lot in common. She's outgoing, she's outspoken, she's energetic. Let me actually introduce you, Chase. She's a passionate advocate for workplace wellness, blending storytelling, science, and humor to inspire meaningful change. She is the founder and CEO of Wellbeing Think Tank, a 501c3, as MBGH is, known for amplifying experts over influencers and providing free educational events that support individual organizational well-being. She is a U.S. Army veteran. Thank you for your service, Chase. That's very exciting. And has over 20 years of experience helping organizations implement evidence-based strategies that drive meaningful cultural change. Let's welcome Chase. I'm going to ask you your question.
Yeah, thank you.
We are asking each speaker to answer a question. We had a question last night at dinner. This one's different, okay? Share one small habit that helps you stay steady when life gets complicated.
I'm very excited to answer this, but I'm going to make all of you participate with me. So how many of you are familiar with box breathing? So how many of you are aggressive left lane drivers? Yeah, I am a left lane, like go, like get out of my way. And so I'm a very kind of aggressive driver. And so that's when I find I need to do this. But whenever I am feeling overwhelmed, or if you chat with me at any point, and some of you have, I am very excitable. I get very excited. I get very kind of hyper. So box breathing really helps me. So I figured we could do a little bit of it together this morning to kind of center ourselves, and it'll also center me as I get ready to chat with you all. So we're going to end up breathing in for 4 counts, holding for 4 counts, exhaling for 4, holding for 4. We're just going to do like 3 rounds, but see how you feel right now. Do whatever feels good. And we're just going to breathe in, 2, 3, 4, and hold, 2, 3, 4, and exhale, 2, 3, 4, and hold, 2, 3, 4, and inhale, 2, 3, 4, and hold, 2, 3, 4, and exhale, 2, 3, 4, and hold. Last round, and inhale, 2, 3, 4, and hold, 2, 3, 4, and exhale, 2, 3, 4, and hold. How are you feeling? Good? Okay, here's my clicker. All right. So I love to do box breathing. It's really helpful. So why are we here today? And I hate to read off notes. I might do it just a little bit right now because I want to make sure I say everything I want to do. But over the past 6 years, we've talked more about mental health in the workplace than I think we really ever have before. And on one hand, I think this is really something to celebrate. We've been working really hard over the past several years to break stigma, to make mental health in the workplace more of a common conversation. And we've really made progress. We've normalized conversations that used to feel uncomfortable, and organizations are investing real dollars. Yet, I think we still have a long way to go. How many of you feel the same way? Absolutely. There's so many issues, right? We need recovery-friendly workplaces. We need workplaces that support caregivers. We need to talk about things like treatment-resistant depression, moral injury in the workplace, and really what it's like to just be a messy human at work. As I like to say, we're all just a bunch of trauma bags coming into the workplace. And we really need to consider this intersectionality, right, of mental health and chronic conditions, because there is a huge tie-in there. We're really starting to have these conversations more, but what hasn't expanded is how we're approaching the strategies. Are we really aligning mental health as an integrated strategy, or are we still just focused on programs? Are we simply pointing at our workforce and say, here's a new resource, please fix yourself? Or are we looking in the mirror at the organizations and systems that our organizations have that might be causing harm to our workforce? Early in the pandemic, I can't tell you how many organizations I spoke with that would say, hey, Chase, we got this much money. Should we buy X or Y? And I would really have to have this conversation and try to peel the onion back and, well, what are you trying to do? What's the problem we're really trying to solve for here? And well, I don't know. People are stressed. We have high turnover. I think people are burned out. It was just vibes, no real data happening. And when we're going off vibes, we tend not to see the results we want. We see those conversations frequently, right? About this isn't working. We're not getting the ROI or the VOI we want. So also, I would have conversations of look at our claims data. I can't tell you how many meetings I've also sat in the last several years of our pharmacy spend is up. This is how many people are accessing care. But what if they weren't accessing care? What if they weren't on that medication? How would that be impacting productivity, retention, engagement, all of these other metrics we want to view? So there's so much great work being done, but how can we get to being proactive instead of reactive? And again, how can we design workplaces that at a bare minimum are not causing harm? I often say that when it comes to well-being at work, all you need to do is everything, because everything is impacting our well-being at work. It's the policies, it's the environments, it's our leaders. Of course, benefits is a piece of that puzzle, but everything is impacting our health and well-being at work, and we need to learn how to take that step back and think about our strategies as an integrated approach. It really lives in the system, and there isn't one right way to do this work at every single organization. Because look in this room, if I ask you what well-being means to you, every single one of you is going to tell me something different depending on what's going on in your life. And what works for one workplace might not work at another workplace. But that's why events like this are so important, because this is where we come together and we talk to one another and we learn from one another. What are you doing? What's working? What's not working? What have you tried? That's really how we move things forward. So this morning, we're really going to focus on clarity about what we're really trying to improve and how we approach this work. So a lot of times I get asked, like, Chase, are you always like this? You're so excited and everything. And yes, I really am. I am like this all the time. I'm very passionate about this work. What I want you to know about me is that I've been doing this work over 20 years, and I've been on every side of this industry. I have sat on the plan side, on the broker side, on the vendor side. I have been in HR. I've been a consultant to HR. I'm an organizational psychologist by trade. I just have this really funky background inside the benefits industry as well. And I've done this work for so long that I've seen change, which makes me excited. Now, about 6 years ago, this is what life was looking like for all of us, right? Very excited. No one wants to be reminded of this. But this is really when the mental health conversation kind of started to come up more. And it's great. Again, I think we've made so much progress the last several years and really helping break down some stigma. But again, we have a lot of work to go, because now it's 6 years later and it just looks like this. We're back in the office. Congratulations, RTO, everyone. But everything's still on fire. And the world is messy. It's messier than it's ever been. And the thing is, things are always going to be happening. There's always going to be trauma. There's always going to be strife. Life is hard. Work should not make life any harder. And in fact, we can improve workplaces and truly create workplaces that are supporting our health and well-being. So that's what we're going to talk about this morning. And I think one of the biggest problems I see is this lack of defining what is the actual problem we're trying to solve for. And if we don't define that first, we really can't get to the results we want. So now that it's morning, hopefully you've all had a little coffee and you're awake, we're going to play a pop quiz. So we're going to see how you're doing. And everyone online, you can play as well in the chat. So in the chat, you can simply enter 1, 2, or 3. And here in the room, you can just raise your hand and you're going to give me a 1, 2, or a 3. So with each thing I'm going to introduce or pop up on the screen, I want to know, is it an intervention? 1. Is it a program? 2, or is it a strategy? 3. So let's start with our employee assistance programs and member assistance programs. Is it a 1, a 2, or a 3? So put your hands up. This is not scary. I'm not making you yell anything out. I'm not making you stand up. Oh, intervention, program, or strategy? 1, 2, or 3? Okay. And hopefully people are chatting online and getting some answers. Okay. Mental health training. This could be mental health first aid training. It could be a leadership development training about how to support mental health in the workplace. 1, 2, or 3? Okay. Then we have an activity challenge. It could be like a Beat the Chief. It could be a 5K. It could be a walking challenge. It could be moving your body. 1, 2, or 3. We got to wake up a little bit more. I'm not going to make you all stand up. But if I don't see the arms coming up, we're going to have to do something. Yeah, I mean, anyone wants to karaoke tonight? Absolutely, let me know. Okay, now we're gonna have a full-on like incentive program. We're gonna do a biometric screening. We're gonna have people do a health risk assessment. We're gonna give them a little reward. So is this a 1, 2, or a 3? Okay. And then a wellness portal with benefits navigation. So you can log in, maybe it helps you get to the right place at the right time, has lots of programs you can engage in. 1, 2, or 3? Great. So the answer is the same to every single one of these. And that is none of these are strategies. Every single thing here is a program or an intervention, and this is the problem. Now, we might create a strategy for our EAP, but have we created a strategy for the EAP that's tied to our business objectives, that's potentially tied to how we evaluate our leaders? Is it really an integrated strategy for your organization? That's where we need to get to. Programs are great. I'm not saying anything is wrong with programs. We need programs. We need interventions. Those are all a piece of the puzzle. And when I was on the broker side, I remember the president of the brokerage saying, Chase, I just don't understand you. You hate health risk assessments. You hate biometric screenings. And I said, I don't hate biometric screenings at all, Brad. I hate biometric screenings without a strategy. If an organization is going to invest this much money and help people know their numbers, then what? Are we putting them into a cohort? Are we going to identify everyone who has an issue with A1C? Are we going to give them chronic condition management coaching? Are we going to do a follow-up measurement in 6 months and 12 months later? Because that's a strategy. But if we're just going to have an event and have everyone come, well, you just spent like 20 grand. And did you really get anything out of it? We're going to talk about that 1% who found out they had high blood pressure that day, and we all feel good. But we can't sit here. Again, I've been in this industry for so long. Healthcare costs is a huge problem, and we have to come up with a better way. And it's about developing better strategies. So I always say what, why, how, and we have to start with what are the whats. What problem are we trying to solve for? And we really need to think about that. So when you think about mental health in the workplace, what is the problem you're trying to solve for? Are you just trying to improve access to care? Are we trying to close gaps in care? Are we trying to lower our pharmacy spend? Are we actually trying to help people get better? Or are we trying to mitigate cost? Or is it both? Hopefully, both, but we really have to identify what is the problem and what are we going to do. And I see a lot of reactivity in employers, but not enough time really spent thinking about this and really identifying the problem. And a healthcare cost containment strategy is extremely different than a health outcomes improvement strategy. So 2 very different strategies, 2 very different financial implications, but again, we cannot silo benefits from everything else because we have other problems at our organizations, right? We have problems with like attrition. And so when we think about measuring the impact, are we truly measuring a cohort of people who have been at the organization year over year and we can see the improvement? Or do we have such a problem with turnover that we're kind of constantly measuring new data from our population anyway? We can't silo the business problem of healthcare cost from the business problem of retention and recruiting and employee engagement. All of these things are tied together. And congratulations, many of you get to deal with all of these problems, right? How many of you you're in charge of benefits and you're in like a yes and role? Anyone? You sort of have to play in those other spaces as well. The next thing we have to do is start to align. So how can we start to align things? So then it's what are the whys? And the first thing is, why is this important to the organization? So why is this issue, mental health, chronic conditions, healthcare costs, why is it important to your organization? So I am asking for a response. Retention. What was the second? Productivity. Oh, yeah, we love the productivity word. Happiness. I love that you said that. So I always like to say happy, healthy, productive. Organizations, we love that word productivity. Give me a C-suite, give me a CFO. We love to talk about productivity. I will tell you though, I never use the word productivity with my workforce. And I highly recommend you don't either. That P word, productivity, that is for the C-suite. That is when we're having these strategic conversations. It doesn't, you were so productive today. We really care about your productivity. But instead, I call it like P squared. It's really, when you leave work every day, I mean, imagine a world where you left work and you felt accomplished. You felt good. You felt like you had the energy to then go pursue your passions and the other things you're happy about. The first question we asked, what do you like to do after work? Whoever put petting a cat, I'm a cat person and I was very excited to see that. So I was showing off cat pictures last night. But that's what we want. But when we're thinking about our strategies, what are the whys? Why is this important to the organization? And we need to figure out why it's important to this person. Why is it important to the person holding the resources? How many of you have had to have a very direct conversation with your C-suite on what is a culture of well-being? Why are we focused on mental health right now? What does success look like to the organization? These are conversations we have to be comfortable having. Years ago, I remember I had like a junior account manager say, Chase, I have no idea what to do with this organization. I'm talking to the C-suite and I just don't know what they want. And I was able to get on the phone with him and say, tell me, you want to build this culture of health and well-being. Tell me more about what that means to you. What does success look like? And he said, well, Chase, I have this much money budgeted for the incentive program. So we need to make it hard enough that only 50% of the population qualifies. So that way I can save some money. So I was like, okay, we're not looking at a health outcomes improvement strategy here. We're looking at a healthcare cost containment strategy. And that's fine. I know how to do that. If we're just going to look at it from that fiduciary lens, great. We're going to put those blinders on. Then, of course, there's a lot of work. How do we make this palatable to our workforce? It's a lot of nuance, right? But we really have to ask our senior leaders, our C-suite, this question of what does success look like? What are we trying to accomplish here? Because that's also how we get the resources. And from our seats, if you're sitting here and saying, well, I really want to help our workforce, I want to be there, I want to make sure everyone feels like they belong. Belonging, leading indicator of well-being. We should build cultures of belonging at work. And guess what? That helps with our mental health. We should be training our leaders. That's like the lowest common denominator anytime I have these conversations about what needs to happen. Leaders need more training. So we might know that. But if our C-suite is saying, I need to see a reduction in this, I need to see an improvement in this dollar spend, we have to start there and make our pitch, make our strategy pitch that so we can get the resources we need. And then along the way, we're going to start to make those other human investments and changes that we need. Is that starting to kind of sound good? Are we doing a lot of this right now? Sort of, maybe, somewhat, every now and then? And then we really have to ask ourselves, why are we taking a specific action? So when we're doing programs and interventions, there's really no wrong reason. So what are you doing? It can be a walking challenge. What are you doing? It can be mental health first aid training. Why are you doing it? And then how are we going to measure if it's successful? And it can be to have fun. You could have someone come in and do a really fun I've worked with improv comics a lot. Like 15 years ago, I worked at Google and we had improv come in and teach us how to do brainstorming and have all these fun games, team building and bonding. Those are great things to do. Why are we doing it? It could be to have fun. It could be to measure participation, but how do we define what success looks like? So really thinking about the what, the why, and the how. And that's what we're going to look at next. We can't get to the how without first understanding what and why. And this is where I see a lot of programs fail. I don't know why people love to send me those articles that come out every week that wellness programs don't work and all of these things are silly. And I don't even need to look at the article. And I'm like, well, of course it doesn't work. It was a program. It wasn't part of an integrated strategy. And I have done this hard work. And I'll tell you, I have done the work that a lot of people say has never been done before. I have worked with self-funded claims data, and I have matched self-funded claims data to things like employee engagement data, DEIB data, leadership data, and really seen that whole picture. I've worked with some brilliant data scientists in my career, and I've worked with these self-funded clients, and you can see the change. It's pretty amazing. But again, what are we trying to measure? What does success look like, and how are we going to measure it? I find this is really missing in so many strategic conversations. And we're going to do this big mental health initiative. We're going to roll out this new program. Okay, why are we doing this program? Does our workforce even want it? Are they going to take advantage of it? How are we going to communicate it? How are we going to train our managers to talk about it? How are we going to create an environment of support that allows them to participate? So maybe you do roll out a new mental health initiative like a robust EAP, and I love my EAPs, they're great. But what is the communication strategy? Can people take advantage of it during the workday? Are we going to allow a shift worker to go into a specific room that's maybe been designated and they can get on a laptop and they can actually have an appointment? Are we reducing the barriers that are preventing someone to get that access to care in the first place? So we really have to think differently and take that step back and think about the bigger picture. And it really comes down to this. How are we going to measure success and track those outcomes? So what kind of data points are we looking for? What is most important to the organization? And again, going back to that why, what and why, what's really important to our C-suite, and what is kind of the data they want to see happen? If we figure that out and start to make them happy first, that gives us more resources to do more of the initiatives that we think maybe we should really be doing. But we really have to learn how to play that game. Paul has seen me do this several times. I call this corporate chase. And I put on my like corporate chase glasses and I change my voice and I can go this and be like, hey, I've been looking at all the data in your organization. Gosh, you are so successful. You are making so I can help you make more money. And I'm like, these are things I've noticed in your data. And we have to figure out what is important to them. And a lot of times it's those dollar signs. So it's learning what's important to our C-suite. How can we start to build that conversation? And then we kind of sell all these things that we want to do. But it works better when we put it into a program. Into a strategy. So when we're in the planning process, these are the questions I always want to ask. What problem are we trying to solve and why is this important to the organization? So when we're in that strategic planning, that's the first two questions I ask. Then when we're executing, what are we doing and why are we doing it? And again, what are we going to do? There's very few wrong answers here. Now, some wrong answers would be, please don't have things like Biggest Loser contests. Please don't do things that are actively causing harm to your workforce. I mean, something like that's going to cause mental harm to a portion of your workforce who struggles with disordered eating patterns or body image issues. So there's ways we can approach well-being in a trauma-informed way. Why are we doing it? Again, it can be a silly thing. It could be to just bring people together, to have fun. But if we haven't figured out how are we going to measure success and track outcomes, the rest of it is pointless. And again, whenever people send me those articles, I feel like they've never defined what does success look like. So if there's anything you do after this, try to get in front of your C-suite, try to get in front of whoever holds those purse strings and ask them, what does creating a culture of well-being look like at our organization? Or what does having a robust total reward strategy look like? What does having a best-in-class benefits program look like? And just listen. Say, how would you like us to measure that? What does success look like? 12 months when we're sitting here, when we're going through renewals or when we're planning for next year's strategy, what does success look like? And then that's how we start to build our strategy. And again, then we can pull in all the other things we want to do. How's everyone doing? I feel like I'm talking really fast. Okay. So now we're going to integrate and measure. So one of the big problems I see in our industry as well is we tend to remain very siloed. And I kind of talked about it at the beginning. Benefits. We sit here in this benefits little silo, but benefits is just a piece of our overarching puzzle, and we cannot solve problems by ourselves. I am very smart. I am very confident in what I do, and I am smart enough to know I don't know everything. It is more important that I am on a cross-functional collaborative team, because when you have an idea and you have an idea and you have an idea and we talk about it, that is when greatness happens. So we really have to break down silos at our organizations and in our industry as a whole. And this is a great example of us collaborating right now with the Midwest Business Group on Health. So at your organizations, if we think about this, who are all the stakeholders that should be a part of these benefits conversations? You can just yell them out. Accounting, yes. Financial. Who else should be a part? Communications, absolutely. Employee experience, yes. Should the benefits people be in the room? HR, everyone, lots of people need to be in the room. Human resources, of course, a lot of times we're the ones leading these initiatives. Obviously benefits, so sometimes we do have a large HR team, so we have benefits people, we have L&D people, we have recruiting, retention. The executive team has to be a part of these conversations. Our people leaders, so our frontline and mid-management, we need to have some representation there, because again, these are the individuals leading these programs. Learning and development, corporate communications, labor representation, if that's appropriate, ERGs in your workforce. I'm really glad you brought up employee experience, and that does mean the voice of the workforce. And it doesn't mean we're guessing at what the workforce wants. It means we are asking them what they want. And we're going to talk about data collection next. But this is always really interesting. How many of you are working on a cross-functional team now that has all these stakeholders? Anyone? Just a couple people, so that's good. We do have a couple people. Raise your hands high, because everyone should kind of chat with you and say, how are you doing this at your organization? If I could wave a magic wand, at a bare minimum twice a year, we would get all of these people in a room together to talk about our organizational strategy. What do we need as an organization? Well, we need to be a profitable company, right? So we can keep everyone employed. So what are our key objectives as a company? And then how are we defining our key performance indicator, our OKRs, whatever kind of corporate terminology you use at your organization, how is that going to tie into the corporate objectives? And then where do we have some cross-functional responsibility? So you might have a learning and development team, and they say, oh, we need to train our leaders on mental health. We need to do this. We're going to bring in speakers. We're going to do workshops. Well, are they working with corporate communications? How is that tying into the benefits team? There's probably a lot of overlap on your objectives and the results you're trying to achieve. So we really need to start working together and stop working in silos. So at the beginning of the year, how do we have this planning meeting? And then at the end of the year, hopefully we're going to get together and have a ton of fun and be saying, look at all the great work we accomplished together and look at all these results we did by working together. So I'll give an example of how this can completely fall flat when this doesn't happen. I remember going into, and I was working with a very large bank, and they were very confused as to why a lot of their activity programs weren't going well. And I said, well, they had a policy that everyone had to dress up nicely for work. This includes individuals in the call center, people who are working in a call center who literally never physically interface with a client, but they had to be business, and I wouldn't even say business casual. They had to be dressed business smart. So women, slacks, skirts, hose, dress shoes, men, obviously slacks, dress shoes. And you're wondering why people aren't participating in the walking program? I obviously am. I've also had 5-foot surgery, so I'm always in tennis shoes, no matter what. But if people aren't dressed, so that's a policy issue, which can tie to HR, but also do people even know about it? A lot of times when we talk about mental health initiatives, it's not a part of our overarching corporate communication strategy. So we implement and we invest in some of our vendor partners who do amazing things and can really create amazing results. But if we don't strategically embed them into our larger communication strategy, it kind of doesn't hit. I'll share another example of, I was working with a large alcohol distribution company. So they distribute alcohol everywhere. They have a big warehouse. They have truck drivers. They have salespeople. They have all kinds of things. And they brought me in. And before they brought me in, they were doing really great work. They were doing health risk assessment, biometric screening. They had an incentive program. They had a safety committee. but everything was very piecemealed. They received a credit from their carrier. And so how the safety leader was managing that is if someone knocked on his door and said, hey, I want to play on the soccer team, he'd be like, cool, I got some money. And he would just kind of pass it out. So it wasn't very equitable. So we started working together. And one of the first things we did that we realized there was a gap is frontline leaders were not trained in the benefits. Open enrollment is the absolute worst time to do your benefits communication. Worst time. Open enrollment is for enrollment and compliance. And then the education happens all year round. That's when the education has to happen. So we did a training just for frontline supervisors on the benefits that were available at the organization. So I have a lot of blue collar gentlemen coming in first thing in the morning. I'm like throwing swag at them to try to get them reacting. And I start to tell them about their benefits. And we start to talk about the EAP program. And then a hand raises and he says, okay, so Joe over here, he's going through a divorce right now. And he's like, I do not know what to do with him. He's like, he's struggling. He's like, he can call this number and he can get help and it's free. And I said, he sure can. And then someone else was raised their hand. And then they asked about the legal. And then, all these hands started to come up and it finally clicked. That's a perfect example of we've developed these great programs, we've implemented them, but are we thinking about it strategically? I spent so much time, I went overtime, everyone wanted to stay and ask me questions, and I'm referencing their benefits and teaching them everything. Again, how do we get the right person to the right program at the right time? And then it has to be baked into their corporate strategic communications plan. So how are we communicating our resources throughout the year? So those are just a couple quick stories, and I have so many stories, and I'll be here all day, so feel free to talk to me. Now, I love to talk about data. I love, MBGH, you're talking about the data. You collect a ton of data. You have a survey that just came out and everything. Data is very important. Now, if I say we want to capture this voice of the employee, we want to capture employee experience, what's one of the first objections we get? Of why we can't ask our employees something?
Privacy issues.
Privacy issues? Anything else? Yes. I love that. This is usually what I hear, a survey fatigue. We can't send out another survey. We have survey fatigue. I don't want to hear. I'm an organizational psychologist. One of the things we study is survey design. It is actually a science. There is no such thing as survey fatigue. That is a made up term. And if anyone says we have survey fatigue, no, you don't. Actually, research shows employees love to give feedback about once a month. How many of you have ever had a bad experience somewhere and you could not wait to write a bad review? You could not wait to tell your friend, they sucked. This is what they did. It was horrible. Or you really did have a delightful experience somewhere, but we're actually not as inclined to do that. We love to share our opinions. We love to tell people what's going on. What we don't like, and you're exactly right, is inaction fatigue. People have inaction fatigue. If you're asked a question and you give your feedback and nothing changes, you're going to stop giving your feedback. So we need to think about these questions better. So we're going to high level kind of go over employee facing data collection, because this is what's going to make our strategies work more than anything. So here are some best practices. Now, when I say third-party administrator, I don't mean our typical TPAs. I mean using a vendor external to the company. As an organization, you should not be sending out your own surveys. You can send out a link. You can control the email. You should not be hosting your own surveys, because I am not taking any survey that my employer sends out if they are the one hosting it. There's a big difference between anonymous and confidential. Confidential means we can still identify that information. Anonymous means it is completely anonymous. You are going to have a lot more success if you do a 100% anonymous survey, but we still add in some clarifying questions for segmentation. We might ask something like, are you a people leader? Or we might segment, how long has someone been in an organization? And sometimes these things are very organizational specific questions. But again, don't send out the surveys yourself and don't write the survey yourself. You are not that special. We all think we're special. We all think no organization is like us. We have a very specific culture. We couldn't possibly use a survey any other organization has ever used, because we are special. You may need some custom questions, and that's normal. Every organization I've ever worked with, we definitely do develop some custom questions. Again, there is a science behind survey design. There's a science behind how we ask questions, and there's a science how we get clean data. And as you all know, I mean, we can talk about healthcare cost containment and like who gets what stories. I mean, I always die when I see these benefits conversations and people are like, we saved $1 million. And then I'm like, oh, you just didn't have a shot claim this year. Like last year you had like 3 preemies and this year you had none. Or you had all these people on Harvoni and now they don't work here anymore. Or someone had stage 4 cancer and now you don't. So our data is really important, but use a third party. So use a third party, anonymous segmentation, evidence-based indexes, facilitated focus groups. This can help really well as well to get the voice of the employee. Again, I would bring in a third party. If I work at your organization, I start talking to people, they don't want to talk to me, but they will talk to a third party. Sometimes you really have to build a lot of trust. I'll tell you, when I've facilitated surveys for organizations before, I will literally have like contacts. You can contact this person with questions. And I'm going to tell you a case study. And I will tell you the first year we rolled out their survey, I had 3 employees directly reach out and I got on the phone with all 3 of them. Is this really anonymous? Can you identify us? I don't want to take this unless I know. And I was able to talk to 3 different employees one-on-one, explain how the survey worked, how we collected the data, what the employer was going to see and what they were going to see. Pulse surveys, we're going to have a great case study on this too. So pulse survey, simple 1-question survey. And what are we measuring? Quantitative and qualitative. So we do need some numbers. Our C-suite loves numbers. They like to see the numerical data. They like to see percentages of improvement. But our qualitative data is just as important. Storytelling is critically important, and you need to embed storytelling into your strategy, especially with communications. So when you have an employee who participates in a program and they have a really great experience, do they feel comfortable sharing that? Can we share out the voice of the employee? It could be my child was struggling with something and I used our benefits and this is how my child got help, or I was struggling with this and I didn't realize that we had this many free sessions and then they were able to pass me off to the next stage of care. And the most important question we have to ask ourselves is, what are we going to do with the data? If we're not going to do anything, we don't ask the question. There's a difference between you want to know and you need to know. Do you need it or do you want it? Would it be nice to have this data, or are we going to do something with it? Do you need to ask gender? Do we need to segment by age? Do we need to segment by how long they've been there? If we're going to do anonymity and segmentation, we really have to ask what's important at this time. So during the pandemic, I did a lot of surveys where we were asking, how long have you been with the organization? Because some people had been there prior to the pandemic starting, some people started during, and the organization was going through a lot of changes. But we really have to think about what's important. I love asking the manager question. One question I typically put in is, are you a leader of people? Yes or no? If yes, do you have access to all the tools, information, and resources to provide support to your team? If no, does your manager have support? Does your manager provide you with the support, accesses, and resources you need? So that's an easy question that we ask for segmentation. But if we're not going to do anything with the data, don't ask it. Have you ever asked about compensation? And everyone says, of course I want more money. If we don't have any more money to give people, don't ask them if they want more compensation. If we're doing any kind of benefits design surveys, don't ask if we cannot respond. And then the most important thing is responding. We have to summarize our responses. We have to tell our workforce what we heard, and then we have to demonstrate. So you always, always, always have to provide a summary of any kind of survey results you do. You need an executive level response. So we need to tell our C-suite, hey, 3 bullet points, here's what we uncovered, because that's all they have time for. Then, of course, we have our full responses. This is something I'm usually doing with someone like you in your role. Let's look at everything. Let's look at the big picture and what we measured. We have to create an employee-facing response. If you do a survey and you're not summarizing it for your workforce and say, hey, we sent out this survey back in January. This is what we heard from you. And if you don't know what you're going to do, that's fine. That's what you tell them. Many of you said you were extremely stressed because we're short-staffed right now. We know. We hear you. We understand staffing is challenging, and we appreciate all of the work you're doing. We don't know what we're going to do yet, or here is what we're trying, or here is when our board meets and we're going to report back, and then you do actually report back after that board meeting. It's really vulnerability and transparency. People do appreciate the truth, even if they don't like it. And I always use RTO as an example. Honestly, if your business is paying for a building and you want butts and seats because you're paying a lot of money from that workspace, if you tell me that, I'm not going to like it, but I'm going to understand why you want me there a few days a week because you've made this investment. And maybe you do something like invest in a nice coffee machine. And then if I get a nice espresso, I'm more willing to come in the morning. But again, it's just about transparency. We have to tell people what the next steps are, even if it's we don't know what we're going to do yet. And you can never forget to reference changes that have been already made because people forget. Have you implemented something really awesome at your organization, which has been well received, but then people completely forget, even though they're using it? Well, you don't do this. It's like, really? Because you've been taking advantage of this awesome thing we've done for years. So we have to remind people, based on last year's survey, we made these changes. And so it helps them feel like, okay, they are listening. They do care. They are going to make change. So if we think about these things, how many of us are doing this 100% perfect? No one. Most of us aren't. But did you get something just from this section of like, ooh, is it making sparks in my, I saw a lot of note taking. So good. Then we have to actually take action. So now that we've done this, what are we going to do? So I'm going to tell you about some case studies. So in 2021, I met with a chain of pediatric clinics, and I was meeting with the CMO. And the first thing she said was, Chase, we got this money and people are stressed. Should I buy A or B? I was told you were the person to ask. So again, I started to peel that onion back. Well, why do you want to invest in this? What's going on? And I started to look at their data and I'm like, well, you don't have an access to care issue. You have a wonderful EAP program. You also have a $0 behavioral health telehealth benefit that no one's taking advantage of. Like, I don't know why you think you have an access to care issue because we don't have an access to care issue. And I begged and pleaded to do a survey, and I finally convinced them to do a 1-question pulse survey. So I sent out this survey, and it was a qualitative question. It was, during this time, what is the most important thing our organization could do to help support your health and happiness and performance at work? Performance, not productivity. Performance at work. Overwhelmingly, guess what people said? Anyone want to guess? They wanted break rooms. They wanted better break rooms. They said, we don't really have a place to decompress after patients or after this thing. One location didn't have a break room at all. That clinic happened to be next to headquarters. Headquarters did have space, and we turned one of those office spaces into the de facto break room for the clinic next door. Now, we took the money we had and we did some things at all of the clinics, like we put in these little waterfall statue things. Everyone wanted music, so we put in like the little, I don't know if we did like the Google Homes or Amazon Echoes, and people could play their music. We invested in pantries. So every single location had cup of noodles, bread, peanut butter, jelly. Everyone wanted coffee. Coffee is a great thing. But each clinic got to decide what they wanted to spend money on. So we empowered the organizations like, hey, you want better break rooms? Great. Here is your amount of money for your specific location. One location got a Keurig. One location got a real espresso machine and had a barista come in and teach them how to pull shots. Another one got an espresso. Again, lots of different options. One location got a panini press. I have never seen people so excited for a panini press in my life. So we did all this, and the CMO the whole time is like, I can't believe we're doing this. Like, I can't believe we're doing this, Chase. I don't know what we're doing. Okay, we're gonna do it. By the way, we had about a 60% response rate from that pulse survey, which is pretty good. So we did all this. 8 weeks later, we invite all the practice managers to a meeting along with the CMO, executive team, myself, and we asked for a report back. How do you think employees felt? Heard. They had never felt so seen and heard and valued. And that's what we all want as humans. Honestly, we overcomplicate this work so much. At the end of the day, we're all humans and we all are a bunch of trauma bags. We're carrying everything into work with us. There are core human needs we can focus on. Then we can get into the personalization and customization. You know, I always like to, I have a lot of Chase-isms, and another one is, of course, as individuals, we have a responsibility to care for our own health and well-being, but the role of a workplace is to, at a bare minimum, not cause harm. So we can start there with not causing harm, then we can start to provide more support. And workplaces can truly be a place of change that can really change us and uplift us in positive ways. That's why I get so excited about this work. So we do this pulse survey. We have this great response. Everyone's like, oh my gosh, this is brilliant. Our lower wage workers were like, this saves me so much money. I don't stop at Starbucks anymore. Like, this is great. I'm saving like $30 a week. Our higher paid physicians were like, oh my gosh, I'm so busy. This has been such a lovely treat to be able to have like this coffee available. So after that, the CMO said, Chase, all right, I believe you. Have fun, go for it. So I partnered with their OD team, their HR, lots of different stakeholders, and we did a very complex survey. For 3 years, we had a 100% response rate. Anonymous survey, how would we know? Because we asked what location they worked at. And I was asked before, and I had to think about it, and it is true. People said, well, did you do an incentive? Did you bribe them? And we actually kind of did. So we said, this is a completely anonymous survey. There's no way for us to know who did it, but we are asking you what location you work at. We know how many people work at each location. So if your location, hits this certain response rate, everybody gets lunch. People like free food. And so again, 100% response rate for 3 years in a row. So that was the impact of a single question. And again, I'll show you their survey. It's like 80 questions. This is not a short little survey. This is an annual survey, everything bundled together, because that's how we should be looking at. We should be looking at engagement, belonging, benefits, leader. We have to look at all that data together. For 3 years in a row, and I'm happy to show you the data. I have my laptop with me and I'm out here all day. Employee engagement, flourishing. So we used the Institute for Healthcare Improvement, expanded Harvard Flourishing Index. Belonging. So I have a proprietary DEIB index, which I developed with Professor Larry Martinez at PSU. We measure things like provider fulfillment, stress, compassion, fatigue, and burnout. Now, I will tell you, we did a lot of work. I mean, we changed policies, we changed pay structure, we changed so many different things. We changed everything to have this kind of impact. And they happen to be a self-funded client. And again, I work with really smart data scientists. And we were able to measure full POP and cohort data and really see the change and how things were impacting, because we finally identified also a cohort population. So I'm going to tell you another little case study. And I love this picture so much, and I actually could not fit them all in here. One of the most important things we have to remember is nothing is one size fits all, and everything does look different at our organizations. And whenever you're working with your partners, as partners, like someone like me is in now, we are not the experts in your organization. You are the expert in your organization. You know your people, you know your culture, you know what's going to kind of vibe. We have to communicate so I fully understand your culture. When I happened to meet this organization, they had been doing a lot of different things and they weren't really having any kind of impact. And I started to ask them, tell me more about your company, your people, all of these things. They all happen to belong to a very specific faith. This is a family-owned business. It's very large. There's multiple organizations. They're all over the state of Washington and Oregon. But they belong to a very specific faith. And in their faith, it's a patriarchal structure. The men work, women typically don't work. If they do work, they don't get married. That's their structure. Very important to know in how we communicate to them. We learn direct mail to the spouse at home who's managing the benefits. It's much better. The most important thing to them is family. They believe to have as many children as God will give you. So we needed to focus on family interventions and how do we get the family involved. And I needed to understand every time I went there, I wore long sleeves, I didn't wear makeup, to be respectful to their faith and everything they believed in. If we don't really understand our population, we can't help introduce things. They don't watch TV, they don't listen to secular music. So these little things that they were trying to do, this population isn't going to participate in that. In our first year, we had over 90% of the population participate in at least one program or intervention. Preventive care compliance increased to 88% because we were able to start communicating to them in the ways that mattered. We were able to talk. We had a lot of blue collar, hardworking men. This is a lot of construction, plumbing, electrical. They're the breadwinners. And we were able to have these conversations like, it's so important for you to prioritize your health. We want to support you in getting your preventive care done. We came up with a policy, a 2-hour float policy. I've done this at a lot of hourly workforces where they get a floating 8 hours a year, 2 hours for their annual preventive, 4 hours, 2 hours each for their dental, and a 2-hour for a vision. You either come in 2 hours late or you leave 2 hours early. Better to leave 2 hours early because the way doctors' offices go. But that leader, that manager of that team is now responsible for making sure people take that 2 hours and go complete their preventive care. They're held responsible. We had a decrease in self-reported stress and anxiety, and we really established this culture of well-being. Why I love this photo, and you can't see everyone, family was so important. Every program and intervention we did, we involved the whole family. This was literally their walking program, and they made these shirts. Their program was called Strive to Thrive, and so the adults had gray shirts, the younger kids had green, and babies have another shirt. I have all these pictures of people in these shirts. So one of the things we did was like family fun day, go out this weekend and do something with your family, try to be active, send us a picture. And we have all these pictures, and then we share these throughout the workforce and other people start seeing it. This was an organization when I first went in, people were making, why are you eating fruit, man? That's silly. And then when I left, it's why aren't you eating that apple? Because we're having this little thing going on right now. Why aren't we talking about mental health? Why aren't we getting our preventive care? So again, it's so critically important to understand what is important to our workforce. We have to stop being prescriptive and start being participatory. So what are we going to take with us from today? This is what I want you to walk away with. Stop confusing activity with strategy. We are doing so much great work. You are doing so much amazing work at your organizations. There is brilliant work being done out there, but it's not going to have the impact it can have if we don't take that step back, work on cross-functional teams, and really create true strategies where we're identifying what are we doing, why are we doing it, how are we going to measure it? What does success look like, and how can we build a roadmap to get there? That's also the question I ask. That's the most important question I ask when I start working with groups. 12 months from now, when we're sitting here, what are the 3 things I need to achieve so you feel like this was successful? Those are our 3 goals for the year. And everything we design goes up into those 3 goals. Define the outcome before funding the intervention. So again, we can't go off vibes. We know we need to invest more in mental health and chronic conditions, but unless we've defined the outcome, we can't really do well. Align our mental health systems across systems, not silos, and then measure what matters and actually act on it. So when we're collecting this feedback, when we're measuring data, what are we going to do then? And how are we going to make that story better? So I took up almost all of our time, but I think we probably have time for a couple questions. I'm also going to be here all day. So I'll be out here. I have a table, but I'm Chase. And did you learn something? Yay!
Wow.
Good. Yeah. The goal is always that you get 1 or 2 nuggets. So did everyone at least get 1 nugget? If you got 1 nugget, then I did my job. And again, you can tell how passionate I am. I mean, there's so much to talk about. So feel free. I'm happy to chat with anyone and help you brainstorm and problems. I'm not going to sell, I don't sell anything. I'm not a vendor. I'm on the nonprofit side now. So I'm just a fun person you can bounce ideas off of, and I'm happy to share data and case studies with you.
That's awesome. Any questions in the room? We probably have time for 1 question. I see one over there. While you're walking over there, there were 2 times that I wanted to have a question ready for you. In the next slide, you answered it.
Oh.
Both cases. So that's
And
exciting.
this question might be because I wasn't listening well enough, but what was the 1 question for the survey that you did with the case study? What was the 1
Oh.
question that you were able to get in the first?
Yeah,
the first-
we did the Pulse survey. It was qualitative. So we did an open-ended question. And we said, what is the most important thing our organization can do right now to support your health, your happiness, and your performance in the workplace? And then it was overwhelmingly, it was break rooms. And there were other things we noticed, like the physicians, they worked on these like standing code. A lot of them were broken and they kept dropping when they were trying to chart. So again, we have to look at the system sometimes. All of this other, it's great, we need to provide this, but again, let's look in the mirror and what can we fix internally? And that will help support our workforce even more than sometimes the interventions we're offering.
And I'll ask 1 quick last question. You gave us a lot of data. And like I said, you answered my question each time. If you had to choose 1 thing that the employers in this room could walk away with, that they could take action on related to what you shared today, what would that one thing be?
Listen to your workforce. You can't be scared to ask your workforce questions. The benefit of bringing in someone, I will tell you, and you're all very smart. You all really know what you're doing, but you can't teach your own family. So you might recommend something and it falls on deaf ears, and then you bring in someone and we say the exact same thing and it's, oh my God, they're so brilliant. That's how vendors are supposed to partner with you. For some reason, they think I'm magical and I'm just really amplifying your voice, and that's what your vendor should do. But whoever you're partnering with, think of it should be a partnership. It should be a relationship where we're really trying to elevate the great work you're doing and help be your voice. But don't be scared to ask your workforce what they want and need. And you can really find a creative way to, yes, I could do a really fun 60-second example.
Sure.
Okay, it's really fun. So we did a survey, an employee, what did they say? They said they want to bring their dogs to work. This was a knife factory. Okay, can't bring dogs to work. But this is found a way to yes. So every year they happen to do an all-employee company picnic, and it's on site, but it's outside. We started a puppy parade during the employee picnic, so people don't even go inside. So we're like, oh, during the employee picnic, you can bring your dogs. We have a puppy parade. So again, it's these silly little things. So ask your employees what they want, need, but don't immediately dismiss it. We can get really creative with how do we find a way to yes. And again, when people feel that basic human needs, seen, heard, and valued, if we focus on that, the rest just kind of falls into place.
Fantastic. Thank you. Really good. I absolutely love that. And I forgot to tell you in the opening that there's going to be a swag bag we're giving out that gives you a complimentary registration to Chase's Wellbeing Think Tank in 2027. There's another swag bag we're giving out to an employer in the room for MBGH's May 4th, 5th, and 6th annual conference. So that's part of the vendor drawing. I didn't share my one habit to stay steady. I've been really trying hard to focus on sleep, and I've been doing box breathing for quite a while, and that helps me fall asleep at night. But I also have been spraying magnesium on the bottom of my feet, followed by lotion, and you all heard that at dinner last night, and it has helped a lot. So I wanted to share 2 quick points from our 2025 Pulse of the Purchaser survey related to mental health benefits. 73% of our respondents are currently offering programs to educate employees on mental health stigma and bias. I think that's really important. 86% are currently offering or considering establishing vendor accountability elements into their contracting, and that's up 11% from the previous year. I think those are really relevant. Okay, we have our break and exhibits next, but I want to share a quick statement from one of our sponsors, CuraLink. CuraLink delivers fast, comprehensive, clinically appropriate mental health care to over 22 million employees and their family members worldwide. Their human-centric model is powered by choice and lifted by tech that keeps people engaged before, during, and after treatment. With industry-leading recovery rates and first-year ROI, CuraLink is a trusted strategic partner that helps people and companies thrive at the same time. And so I would encourage you to go visit all of our sponsors, turn in your prize card by 2:05, and we will reconvene about 2:15. Or excuse me, that would be this afternoon. We will reconvene at 10:15. Thank you so much. Okay, folks, we're going to get started again. If you're in the other room, please come on in here so that we can at least try and stay on time. That's our goal. Paula, you want to go in there and get people? Okay. Let's see. Laurel, is Laurel not here yet? I was going to do my coalition shout out, but I can do that later. Okay, I hope you got a chance to visit the sponsors. I got a head scratcher in there, you know, one of those wire things. So there might be still some more. I don't know. There's some puzzles in there, cool stuff. I am honored to introduce our next keynote. And the primary reason I'm honored is not the impressive company she's been with. It's who she is as a person. It's the fact that I've known her for 25 plus years and she never changed. And she is still as smart and driven and just a good, solid person as she was then. I have no idea if I am Claire. I really don't know. But Claire Miller is a workplace mental health expert drawing from over 25 years of experience focused on improving access to quality care and addressing barriers to wellness. She recently joined Microsoft as the global, for some reason, this is advancing. Are you doing that, Lori? Okay, well, my computer up here has something up and I just want it fixed while I'm chatting. Okay. She recently joined Microsoft as the Global Wellness Benefits Manager, where she supports strategy and management of mental and emotional health and well-being programs. She previously served as the Global Mental Health Benefits Manager at Facebook Meta. She established the Center for Workplace Mental Health at the American Psychiatric Association, and that's where you and I met. And I would go to a lot of sister coalition meetings, and she was always there talking to employers and coalitions about what employers could do to address the stigma, the biases, the benefit design. She gave out these little bears. Laurel, do you remember those little bears? I love that program because it talked a lot about working with your supervisors and managers to express the message. We heard some of that from Chase earlier. She worked at the Business Group on Health, focusing on public policy, mental health, and substance use disorders. I did not know that. We'll talk about that later. And she serves on the board of directors for Mental Health America and Cover My Mental Health. Really, really knowledgeable, really, really passionate. I already said you were a good person. Come on up.
So our next topic is mental agility, bend so you don't break. That's why we were bending, okay, getting ready for this session. We are welcoming to the stage Dr. Doug McKinley. He's a leadership psychologist, executive coach, and author with more than 25 years of experience working with leaders and senior teams across healthcare, nonprofit, and business environments. He has spent his career walking with leaders through the real work of leadership. He is known for his willingness to name blind spots, disrupt unproductive dynamics, and invite courageous conversations that most teams avoid. So he's written 4 books. He brought 2 of his books we'll be raffling off this afternoon, so make sure you get your cards done. And he's also the host of what's called the Leadership Currency podcast, so I recommend checking that out. So with that, let's welcome Dr. McKinley.
You're gonna end and then do 5 minutes will be part of your presentation for Q&A, just so you know.
Okay. Thank you.
Yeah.
That's good. All right, so I'm gonna probably shift this a little bit differently. Is that my control mechanism? I feel better already, especially if it works. Okay. The down arrow.
This.
Oh, so this one isn't working? I don't feel so good now.
Oh, give a stomach ache.
No, yeah, I need a pillow. Anybody got a pillow? There we go.
Oh.
Okay. Well, let me just say it this way. I don't work in the spaces that you do, so I was really thinking I'll shift my focus a little bit to you. Thinking about you as a person and how you are managing your own mental health, if that's okay. All right, so that's going to primarily, but I did have a couple of things. I think Claire mentioned that if you were to ask me what would help mental health in organizations, the first one is you got to get your senior leaders healthy. And I don't know how to help you with that other than I've been spending 25 years with the C-suite, and the places that allow me to partner with them, they're doing some beautiful things. And if they aren't modeling what you're talking about and they're modeling what we call heroic leadership, then you're going to have a challenge because the rest of the culture is going to be affected. The second thing is I think in your meetings, your corporate meetings, we need to bring psychological safety to those meetings. And what I mean by that is have check-ins that feel safe. Those can happen. And I love Claire's comment about clarity and expectations. Also, just take 3 minutes. How's everybody doing today? And then the third thing I would say is we need to build communities at work. I think we can get well at work. And I think by doing some of the stuff that I'm hearing today, it's very encouraging. So that's my 2 cents with what you guys are all involved in. So what I want to talk about is this idea of bend so you don't break. And again, I think about leaders, like a lot of people, wherever I am facilitating, they don't see themselves as leaders. I especially work in healthcare mostly. And I just want you to know that I think we're all leaders. So you're going to see words on the slide, and I'm a leadership consultant, these kind of things. I think we're all leaders, all levels, we're all leaders. We're leading somebody somewhere. Would you agree? Somebody's watching you. Somebody's modeling after you, and you're taking them somewhere. And my calling in life is to come alongside leaders and remind them that we have a responsibility not to just ourselves, but also to those that trust us, those that care about us. So that's just a little bit of a caveat. I'm gonna start with this slide, and why I want to talk about why leaders crack under pressure, right? So what is it that creates that? And it's already, the tip is already there. It's kind of that bend metaphor. But the first thing is, was working. Did I step way too far? What'd you do, Paula? That was clever. No, she did something that made it work. That's what I'm saying.
I'm testing his agility. So closing that, I don't know why that keeps popping up.
There we go. So most leaders don't break because they're weak. They break because they are rigid. You with me? We break because we're rigid. And rigidity happens for many reasons. Psychologists, I'm a psychologist, we've studied this. Because we don't like ambiguity, we create structure, and sometimes it's rigid. It's just too rigid and it can't flex in the ways we need to. The second thing is, I guess I'm gonna have to stand over here. It keeps popping up. So just clear out that slide. All right, the second thing is, where's the down arrow? There it is. The second thing is complex environments. The very strategies that led to success, what got you here won't get you there. I cannot emphasize this enough, that we are creatures of habit, and we think because we're successful that what got us to here today is going to be adequate. And we should know by now, right, that this environment has changed. And the last one is resilience. It isn't about toughness, it's about responsiveness, the ability to adapt and choose wisely, losing oneself. I see this chair here. Can I use it as a prop? Would that be okay, or is it special for? Oh, okay. Well, I always thought I would just sit on it, if that's okay. I don't know what standing on it would look like. So what I want to do is I want to read you a story, and it's a story about a person I was working with, and just for HR people, I have their permission to tell this story. So this picture reminds me of a story of a parent. I'm going to read it because I want the sequence to be clear. Reminds me of a story once shared with me. In their family, they simply called it the night. Parenting is always a mystery, but in this particular night, the mystery turned into something far more dramatic. The father was lying in bed in a hotel room across the country far from where his family lived. It was close to midnight. He remembers the room clearly. Not exactly a place that would pass his mother's inspection. A one-inch gap underneath the door where the streetlights poured in at night and other creatures probably came in. Heavy curtains in some strange shade of green and orange. You know the kind of hotel room? Just as he was drifting off to sleep, the phone rang. It was his oldest son. Hey, Dad, can you talk? The father said, yes. Then the son said something that no parent is prepared to hear. Dad, tonight I decided to kill myself. I wrote you and Mom a note. I left the dorm room with full intention of ending my life. The depression has become just too much. I just can't carry it anymore. Then he paused. For some reason, Dad, I stopped and I decided to call you first. When you talk with parents who have received one of these phone calls, they often describe something very strange that happens. It's like a supernatural shift. Listening becomes hypervigilant, right? Every word matters. But this father said something else happened. Fear set in, overwhelming fear. He later said to me, "Hey, doc, I think I lost my mind. I really do. I think I lost my mind. My emotions just took over." Somehow, in the middle of that terrifying conversation, the son agreed to pause his plan and meet with his parents as soon as possible. The father hung up the phone with one thought racing through his mind. Can I get to my son before he changes his mind? What followed was 10 hours of frantic movement, taxi to the airport, the first flight he could find, another taxi across the state. His wife had already reached the campus before him. They met in the dorm room parking lot just after sunrise, and together they walked into the building with fear and trembling, not knowing what they'd find on the other side of the door. Now, I want you to pause for a moment for the purpose of you today. Just imagine that phone call. Maybe some of you have had it. I've talked to many people that have. In moments like that, none of our leadership books matter, none of our education matters, experience doesn't even matter. What matters is how your mind and your body respond. What matters is how your mind and your body respond. Because when life delivers moments like that, something inside of us gets revealed, not competence, but character. And in those moments, there are usually only two ways we'll show up. A rigid way of being or an adaptive way of being. Or said another way, rigid minds break, agile minds bend. And that is what mental agility is about. This parent was now exposed and he had to find his way. Just like him, all of us had to find our way through those bend but don't break moments. Now, because I'm a psychologist, I just want to remind us that some of this is not on us. It's not all under control. We have neuroscience and neurochemistry going on. And just, you've read this, but I want to let you know it's true. Like, I've studied it, I believe it. I think neuroscience has come a long way. And the amygdala acts like an alarm system to your psyche. And it scans for danger. When it senses threat, it can trigger a survival response before the thinking part of your brain can even catch up, right? We all have had these experiences. That is why people fight, flee, freeze, shut down, get defensive, say things they regret, or go emotionally numb. The body floods with stress chemistry, heart rises, muscles tighten, breathing shortens, attention narrows. In that moment, here's the key: you are not stupid and you are not weak. You got hijacked. You got hijacked. Mental agility is the ability to notice that hijack happening to you and receive and recover before that moment owns you. It is the capacity to pause, regulate, and choose a response that is aligned with who you want to be. That is why this conversation matters, because pressure does not reveal our competence, it reveals our character. So as you let me just share what I've learned about this over the years. I just want to highlight a couple of things. And the first one is I'm going to talk about are what I'm calling the 3 pillars. There's the sentence. So let's just say this together, can we? Rigid minds break, agile minds bend. One more time. Rigid minds break, agile minds bend. So the 3 pillars of the mental agility are self-awareness, self-regulation, and adaptive leadership or adaptive responses. And we're going to cover each of these in different ways. And if you'll allow me, I'll give you some insights and case studies to help. So self-awareness, of course, is, I think it's probably the precursor for all learning and development. I think that it's one of those things that without it, where are we? We don't know where we're at. And then self-regulation is basically what we talk about in terms of emotional intelligence. Hopefully we're talking about this, are we? In Spaces? When I first started, my clinical career ended around 2002, so I had a practice here in Naperville, Illinois, not too far from here, and practiced for over 20 years, and then I got into organizational psychology. And it's a game changer when we can begin to talk about that. At the time, I had a PhD student doing a dissertation, and she studied emotional intelligence. And this is just an aside, it has nothing to do with this. But her thesis was that women have higher emotional intelligence than men. So I took on that assignment. I was her chair. And unfortunately, for women in the room, it's not true. Just so you know, we do have different types of emotional intelligence. That is true. But we all have access to emotional intelligence, despite some of the stereotypes that we want to believe. So let's go through into each one of these. I think the first, probably the most helpful metaphor, if you will, these two slides is one of the most helpful tools that I can think of around self-awareness. And this first one is what's called mind like water. You might have seen it in a karate movie or something, but the basic idea here is when things happen, and I think Claire was talking about we need to suicide. What was the next one? The three things of prioritization. Not being able to go to work. Yeah, just how impaired are you? Something happens that sort of the pebble in your lives sometimes turn out to be boulders for you, and they don't need to be, because if your mind is like water, then you'll respond appropriately to the stressor that's there. Now, here's the caveat. A lot of us think about and experience stress differently. And so to some of us, what would be a pebble, it's a boulder. And for some of us, what would be a boulder is a pebble. And so we have to know ourselves and understand that. And I see most of the judgment and shame-based conversations in workplace based around these differences. Whether you have personality assessments, you have people talking to each other, talent calibrations are one of the most dangerous, toxic places I've ever been in a meeting with. Please be better. HR people, we can be better. We are people. And I've seen careers end the way people talk about talent, and it's just we can be better. And so we've got to learn this. Recently, I work in a lot of academic medical centers, and recently in the last couple of years, I was in one, and they changed something called the funds flow model. And on the West Coast, the East Coast, and South now, they're doing a different way of distributing the funds inside these academic medical centers. And would you know that I probably spend, over the last 3 years, I was working with 25 or 30 different leaders around this organization. And there were people that left their jobs, moved across country, moved their families because of this change, the systemic change at the top. And don't underestimate those changes that you are making. And I kept having conversations with people because I was aware I was at the seat of the table with the strategy and what they were doing, that it really wasn't going to affect them personally. It was just going to affect how the whole system, how the whole distribution of money was there. And it was really troubling that it took me a long time to get people to make that shift from what was really happening to what they were afraid was going to happen. You with me? So mind like water is something that you can use every day in your workplace and in your life to say, okay, what is this? Name it. When COVID hit, that was the number I was called. I was frequently being used. And the biggest thing I did to help was to say, give this thing a name. My favorite one was it's Groundhog's Day, right? So that's or a science fiction movie, those kind of things. So the other thing I want to just highlight here is that there seems to be 3 traps that are kind of universal to all people. And so I don't want to spend a lot of time on these, but I think we see people in these cycles at work. The first one is what I would call a compulsive yes. This is kind of the excessive activity person. Somebody mentioned it earlier. I think that was Chase. And yeah, a compulsive yes is just somebody they've strangely overvalued activity for effectiveness. And they're just caught in this cycle, this trap of just the more I can do, the more I can do, the more I can do. And it's really a quite destructive pattern. The second one that we're all familiar with also is the achievement people. Achievement is beautiful. It does empower us. It gives us dopamine hits. But this is all about the accomplishment, hustle. How do I accomplish more things in a quicker amount of time and outperform? With physicians, and they have these things called RVUs. I forget what it stands for. Do you know what it stands for? RVU, some relative value something. That's good. And, I'm working with physicians that are outperforming other physicians by 200%. And I'm like, do you get a bonus? Like, what's going on here? Do you get more vacation time? And they're like, no. I'm like, what are you doing? Like, really? It's like people don't take vacation time, right? Physicians are notorious for this. By the way, physicians die on average 10 years younger than the rest of the population. I don't know if you know that. We're terrible at self-care. And so that's a trap, very important in self-awareness. And then what I would call more of what's called the crowded soul, or too many priorities. Some of us are flying around all around the country in the Middle East, and they're getting calls in the Middle East during the talk, and they are so crowded. Thankfully, she gave us an end to that story. That was called Modeling the Way. Claire, thank you. And I have a good manager. I have somebody with my back, and I'm okay, right? I'm okay. I'm not just surviving. I'm actually thriving. And so this trap is extremely dangerous, and we got to watch it. And it's so subtle because it's seductive. We can do very meaningful things and get trapped by it. And there's no freedom in that. So what I'd like you to do is just take a second and ask yourself, how am I doing in this? Which one of these traps am I most likely to get caught up in? I'll switch back to the slide so you can see it. Don't answer. This is just for you. All right, so that's thinking about self-awareness. So let's move to this topic called self-regulation. Does anybody know what self-regulation means? Well, how would you describe it? Anybody? Self-regulation.
Anyone?
Shout it out. There's words up there you can steal too if you want. Yeah. Right. Huh? Okay. Yeah, it could be. Self-regulation could be even killed depending on your temperament. Yes? Yeah. You're recognizing what's going on, right? And you're at choice. You over there, sir?
Yeah, not letting your highs be too high and your lows to be too low.
Unless you want them to be. Let's take Chase, for example. This woman's on a high all the time. And so her self-regulation, right? Am I right, Chase? Right. Well, I call it the fifth gear steal. So she took her glasses over here and did that little role play. I'm like, that was awesome. Like, we know that wasn't her, but she was really good at it. And that, she made me like, okay, I know that voice, so let's talk. And so she took her glasses off and took them on. But self-regulation for her looks very different than it would for somebody else, an introvert who is not wired in the way she was. So just be aware that comparison curse will kill you. And so self-regulation is not perfect. It's not emotionless. It's just regulated. And so I want to give you a couple of examples that might help you here. I call the research calls it emotional labor. Well, what the heck is that, Doug? Well, emotional labor is that invisible stuff that just drains you throughout the day, right? And so the one that I have, you didn't ask me my habit, but one habit that I changed several years ago was I travel all around the country, mostly every week, doing gigs. And I was, I don't know what to call it, but the anxiety would build the time on the way to the airport. I was just emotional laboring around the travel schedule, right? I love my job. I'm very comfortable with what I do, but the travel was killing me. And so I just reset a habit and I said, I'm going to be at the airport 1 hour before boarding time. 1 hour before boarding time. Does anybody do this? I see a few nods. Everybody thinks I'm crazy. They're like, what's the problem? Because most people that are wired like me, they want to walk up and be able to walk right on the plane. Like there's a few nods, right? That's a win for you. I just retrained my brain and I said, that's no longer going to be a win for me because it was a game. I could see how close I could push it. And I missed 2 airplanes, which is not a good thing. So it took me twice. Usually it should only take once for you to learn your lesson. So yes, this emotional labor is a real thing. And if we aren't we aren't self-aware and we aren't noticing what's going on with us, we will develop mental health issues. It's not some of them biological, some of them are actually created by our own work, as Claire said, not only at work, but our own work. I spend most of the time working with people on their own way of work because I'm usually working in small teams or one-on-one. And so emotional labor is a real thing. Here's 3 things that I found has just been uber helpful. We heard Chase talk about boundaries. This is my definition of boundaries are needs and expectations that keep you safe in relationships. You setting the needs and expectations you have, expectations that keep you safe in relationships. And by the way, that includes work, right? We got to have that at work or we're not safe. And most of us are really terrible at setting psychological boundaries at work. And the reason is because we didn't learn them at home, right? That's usually the reason it goes back and forth. So boundaries are a real thing and a super helpful tool for you. Shared ownership is this idea that heroic leadership is a very destructive mindset that's going on especially in our healthcare organizations. We reward them, we hail them, and they are just heroic leadership is killing organizational health. And that's what I'm against. That's what I'm working against in the work that I'm doing. And this idea that shared ownership, that I have to do it. If I don't, this is what, honestly, what I think people don't even trust leadership anymore because that's how the leaders they work with function. And so people don't even want to be leaders. When I do leadership talks, they're like, I don't want anything to do with leadership. I don't trust them. You with me? They don't look how I want them. I don't want to live my life like them. I don't want to live like them. And so leadership it used to be a noble, honorable thing. Now I'm actually talking about, well, what do you mean? Like, we got to find a different word or what's going to happen? And so this shared ownership is we are doing this. Like this talk today, I spent a little too much emotional labor trying to figure out what I was going to say to you, as you do if you do speaking. But I realized I'm part of a really cool panel of speakers. I'm just one little part. I'm going to offer one little. Actually, Chase said she offers 1 nugget. I hope you get 2. I'm a little more competitive. So I just want 2 nuggets, right? So I'm going to give you several things. And if you get 2, then I can high five with Chase later and we can say, cool. I wrote a book early on in my therapy career called Mad About Us. It's a book on marriage. And the whole thing was about the way we think about marriage usually is what I get or what they get. There was a famous book called His Needs, Her Needs. There's this guy that wrote a science fiction book about Mars and Venus. You remember that? And I was like, wait a minute. Isn't it about the relationship itself? It's the us. People don't miss their marriages when they get divorced. They miss the us that they thought they could have, the dynamic between them. So that shared ownership is a beautiful mindset tool. And then identity anchoring. The rest of my career, this is what I'm going to spend my time on. Every fall, I hold an identity leadership retreat in Silverton, Colorado. If anybody knows where that is, raise your hand. 300 people live there. Thank you. We got one. They have a beautiful train from Durango to Silverton. It's part of our retreat. But it's about how do we actually anchor ourselves in who we are? Because leadership the impact of your leadership is always going to be more about who you are than what you do. It's just people are going to trust you because of who you are more than what you do. You need both. And so for me, having that sense when I'm really losing my self-regulation, I recenter. I have my calling. I know what my assignment is, and it's a little weird, but I'm just going to share it with you. It's I am a listener and reader of hearts. That's what I'm called to do, and AKA I'm a gentle disruptor. Chase is a disruptor. I'm a gentle disruptor. So just I'll sneak it in there, and that's what I'm here to do. And so if I can have that ability to just center, remind myself, this is what I am. You don't have to tell a frog what to be a frog. Frogs know how to be frogs. I know how to be me. And when you can get clear on that, it's a beautiful piece of work. All right, I lost the clock down there. How are we doing on time? Thank you. I want to leave time for questions, so I'll make it 7. All right. These are some self-adaptive leadership. There's a book called Adaptive Leadership that a couple of Harvard researchers, Heifetz and Lansky, wrote, and they have this thing called the balcony technique, and it's essentially it's metacognition, but it's the ability, like right now, you're sitting in the room, some are listening. Actually, it seems like everybody's listening very well, thank you. And you're listening, but you can also step on the balcony and say, how am I doing right now? Is what Doug's saying something that I want to listen to, or am I just discarding it? Am I taking notes? You have the ability to see yourself, and how you are showing up right now is aware of that. And I'm aware that there's this little thing right here that sticks out on my thing, so I'm trying to pay attention to it and cover it. So we can see, we could see and watch ourselves from the balcony while we're in the midst of the day. And so the balcony technique is a beautiful way to be adaptive and to be the best version of yourself. It's a very popular phrase these days. Nobody knows how to do it. And this is one of the techniques that's going to help you. Responsibility. People take responsibility very heavy. It's a heavy term. And I like to reframe it. I think it's about response ability. What's your ability to respond? Can you respond in a way that's congruent with how you say you want to live your life? And I could tell you how you're doing, if I ask you, are you thriving, surviving, or are you just keeping your head above water, right? And I can usually just determine that based on the degree to which you're making healthy responses. It's usually something inside and outside are not working together. We call it in psychology congruence. And then non-anxious presence. Boy, if I could give one gift to mental health in the workplace, we need to bring a non-anxious presence. And what this is, I think it's the best leadership gift. All my leaders I work with, I talk about this. What you can give to your constituents is a non-anxious presence. For some reason, we think we got to hype it up and, we got to not tell them the truth. We got to tell them the truth, whatever. Just bring it in a way that's not anxious so that you can actually choose your responses, that you are demonstrating calmness. I think Claire said clarity and what was the second C I forget is important. I'm going to add calm. Clarity and something else and calm. Just think about people that you want to be around. Do you want to be around the one that's frantic? I hear this word all the time. Doug, I'm so busy. I'm so busy. It's like a badge of honor. And when I hear that word, it tells me you're out of sync. If that's your lead, how you're doing, I'm busy, something's just probably not sitting right in your soul, right? So it's a beautiful thing. And another Harvard researcher wrote a book called The Failure of Nerve. And that's been the source of that for me. So practice makes presence. You hear it. I'm changing it. Practice makes perfect. It does not. We can striving for perfection has been a neurosis that we're all aware of, and we still think we need to do it. Even like giving these presentations, we're not going to do a perfect presentation, right? The TED Talks, they're pretty good. I have to admit, I watch them, but I've talked to people that do that. They train them. Every TED Talk starts out the same way. An opening sentence, and then they tell a personal story. And I'm like, okay, you could do it. I could do that for 12 minutes also. So Ted hasn't called me. I haven't done one yet, but that would be interesting. And so practice makes presence. Start small, build momentum, choose one strategy to practice this week. And just there's lots of things you can do around that. So mental agility isn't about never feeling pressure. It's about bending wisely with it. There's one more thing I wanted to say, and then I'll take some questions. You did? What should I do with it? All right. Well, maybe this will change it a little bit. So here's kind of what we've gone through today. We've talked about your own ability to be self-aware. What are you doing in that category? For me, my daily habit around self-awareness is that I have to turn off the radio, turn off the noise, turn off the screens, and I have to think. Does that make sense? Does anybody need thinking time? I want that wellness room that somebody talked about somebody last night in their house. I need a thinking room. Like where can I think? Maybe those are the same thing. Self-regulation. What are your habits? What are your systems to paying attention and regulating in the way that you want to? And then adaptation. And of course, mastery is the actual skill of that. So these are all about managing your own resources, not trying to control somebody else's. So that's one thing I wanted to highlight. So the reason we develop mental agility is not so we can endure hardship and look impressive. Please don't think of it that way. This is about something much, much more meaningful. The real purpose is far more simple and far more important, and it's to remain available to serve people and love them. They want to be seen, heard, and valued. That's true. The only way that's going to happen is if we can bring ourselves, our whole self, into that experience. The story that I shared about the father with a suicidal son is not just a story, that was my story. I was the father in that hotel room, Miami. That's why I read the story. That's when I fell apart, right? Fell apart. My mind spiraled. I lost myself, right? I lost my sense of control. Learning these practices did not make me a hero. They helped me stay present when everything in me wanted to give up, collapse, and cave into fear. I did not learn these skills so I could stand on the stage and talk about resilience. I learned them so I could serve my son and care for him, period. And that's why we need to be healthy. It's to be here to serve and to love. That's the reason. It's not to be impressive. Mental agility is not about toughness. It's about relational availability. And it's about staying steady enough. I'm grateful for my son. He is no longer struggling. He's thriving. He's doing well. But it was quite a journey. So that's all I have. If somebody would let me off the stage, I'd be.
You can stay there.
Let me turn around
Thank
and
you.
collect myself. I'm going to self-regulate.
Okay. Thank you for sharing your
All right.
personal story. Even people online were commenting. Thank you for sharing your story. Any questions from the room? One follow-up I would ask is, there was some mention of ambiguity and, your professional opinion, ambiguity and agility, the relationship there.
Yeah, I think ambiguity is something people are afraid of. And my thought is, if we know who we are and we are practicing, these are just practices that we don't ever get perfect. We know who we are, we're practicing self-awareness, self-regulation, then we're going to show up to ambiguity because we're just going to take it one step at a time. So I would say, yes, I think they're very similar. I think agility is probably the verb of how we engage in ambiguity. It's going to have to just, when we used to do 5-year, 10-year strategic plans, I used to do those strategic plans, and now they're like 90 days. Like, what's the next 90 days? How are we going to get there? So I think agility is the verb of living in ambiguity, one of them.
Thank you. And then what about the over agile leader or over agility? Can that be a problem or is that a thing?
Yeah, that's one of those traps. If you're over agile, you're just trying to add more. These are some resources that if you want to check it out, I forgot to say. The over agile leader is somebody that's addicted. They're addicted or they're just caught in one of that trap. Probably the shallow winds or the crowded soul trap. They're adapting so frequently and so often they're going to lose sight of themselves. So yeah, it's those 3 traps are universal and they catch all of us. Mine tend to be 2 and 3. Tends to be where I land.
I have a quick question for you. That was absolutely amazing. And I'm so glad that your son is doing well today. The 3 traps.
That's called empathy. Well done. Thank you.
Thank you. Thank you. Thank you. The 3 traps, if you could give one recommendation for the people in this room that identified them in whatever of those buckets there were, what would that recommendation to get started be?
They've identified, because one of the action steps is to identify a trap. I think once you know what it is, then I think now you can engage. You're bright. All of you are bright. We've all been saying it. We have skills. We have tools. Then you got to ask for help. Like, tell somebody. When I was lost at sea, I hid from all of my friends. I was so scared that I didn't talk to anybody, right? And it was a mistake, right? So reach out, ask for help. Once you ask for help, then you start the healing pathways, right? So that's how that happens.
Thank you. Any other questions in the room, comments?
Thank you. I'll get off the stage now.
Oh, we got, no. Oh, not too fast. We did have a hand raised back here. Sorry.
Wave away.
The part where you had the self-regulation, I just wanted to just say how important that is. I know, like you said, everybody's bright and we all have careers, and but sometimes that piece right there is still not in a person, and sometimes you have to work with people that don't have it, and then you have to like really self-regulate yourself. So, I just use my sons as an example. I taught them from a very early age to self-regulate because that's most important. Those are the things people are going to remember,
Correct.
that you were able to not just, what do kids call it now, crash out?
Yeah.
Yeah, you were able not to crash, you didn't crash out, or you were able to stay in the room and stay in the moment. So I just wanted to say thank you. I appreciate you bringing that up.
Yeah, and I love your response. That's a response-able person. If your response is to try to get others to self-regulate, what's going to happen? They're going to be mad and you're going to lose your own. Like, you're going to lose your shit. That's where you'll lose your shit, because you're trying to manage somebody else's trauma bag. Is that what it's a new term of art? I didn't know about trauma bags. So they have trauma bags they're managing. Don't you have enough work yourself. Just self-regulate. And you just watch people be responsive to you, because we are attracted to people that can do this. Okay, thanks.
Thank you so much. All right. Thank you for getting us back on time too. So we are going to, and all of the slides and the QR code, the links, the resources are all in the PowerPoint deck in the mobile app if you're looking for those. So before we go into break, just another message from one of our sponsors, Lilly. And Lilly sponsored our dinner last night. Lilly unites caring with discovery to create medicines that make life better for people around the world. They've been pioneering life-changing discoveries for nearly 150 years, and today our medicines help more than 51 million people across the globe. To learn more, visit lilly.com, or you can visit their table in the room here as well. So we are going to move into lunch. Please make sure to visit all of our exhibitors. Get your card filled out and drop them off at the front desk registration desk. We are giving out, as Cheryl mentioned, a pass to Chase's annual summit. And we have the two books from Dr. McKinley, and then a pass to our annual conference as well. So make sure you drop that off and enjoy lunch. We'll see you back in here at 12:50. Thank you.
Well, thank you so much. I hope you enjoyed your lunch. Who had one of those little chocolate circular things? Like a mini piece of cake, right? Delicious. That's one of my favorite lunches here. I know recently we had somebody write in that they didn't like the salad, and I was like, sorry, but it's so good, right? Yes, good. What a morning. What a fabulous morning. 3 different speakers, interconnected in their message, reinforcing of each other. I very much enjoyed it. I have to get my note. Thank you. So I'm excited about this panel because we've got 2 experts here, and they're moving it from the clinical level into the business space level. And I'm going to start by introducing our first speaker, David Pawlowski, who is the Chief Operating Officer at CureLink Healthcare. He's a licensed clinical professional counselor, LCPC, I see the acronym, in the state of Illinois, with over 25 years of experience in the mental health field, including nearly 20 years in workforce mental health. He's a certified certified employee assistance professional with expertise in engaging, empowering clients and organizations through solution-focused counseling and consultation. Dr. David Kraus is one of the foremost experts in identifying the unique strengths and skills of behavioral. Should I have started? David. Okay, there we go. David Kraus is one of the foremost experts in identifying the unique strengths and skills of behavioral health providers. His research has quadrupled the number of patients that return to full health and productivity without relapse when you compare it to some of the other studies or best practice studies out there. The process assesses each patient's unique need with a comprehensive patient-reported assessment. Funding for this work has come from leading private and public institutions, including the National Institutions of Health, the Duke Endowment, the KCE Foundation, and the Patient-Centered Outcomes Research Institute. And as I mentioned earlier today, we're having a PCORI event. And as most of you know, employers pay a fee for PCORI research. This is something I think is very exciting that you're going to want to learn more about. And both of them are going to be talking back and forth about their models and what they're doing to support employers. And I'm going to let them each just share 1 or 2 minutes at the opening about who they are and what they do. And I'm going to start with you, Dave.
So you want to know a little bit about who I am and what I do? Yes. So I lead operations at a global workforce behavioral health provider, or EAP, based here in Chicago. I have been in the behavioral health field my entire career. So I started actually working with folks with more severe chronic mental health and substance use challenges in the non-for-profit world. And then I actually kind of got involved in EAP sort of randomly. I had an opportunity at an organization where my wife was moving to in Chicago, and took the opportunity and really fell in love with the combination of not just, supporting employees and helping them reach their full potential, but also helping to strengthen organizations and help organizations build resilience as well through all of the different types of business challenges and even social challenges and events that happen that can be disruptive or traumatic to folks at all levels of an organization. So I have found my passion in EAP, and I continue to want to do it as long as I possibly can. So thank you.
It shows.
Yeah.
Thank you.
All right.
David.
Hi, everybody. David Kraus. I'm a clinical psychologist. Started my career 35 or so years ago as an assistant professor of child psychiatry at UMass Medical School, where I was training new MDs on how to assess and treat complex trauma. My day job was to run the inpatient unit for the most traumatized kids in Massachusetts. And I got very discouraged at how we assign cases in all levels of behavioral health care. It's very random. In the case of our inpatient unit, our chair of psychiatry said to me, whoever had the last discharge gets the next admission. Had nothing to do with the alignment of the kids' needs with our team's skills. And I basically have now spent the last 35 years helping various research teams study as Cheryl said, identifying the unique skills of behavioral health providers and leveraging them. It's one of PCORI's most successful projects. We're co-hosting the event tomorrow for folks that want to hear more about it. But the simple piece, the nugget in this is instead of trying to figure out what the right therapy and training providers on learning the latest therapy technique, it's really who's the right therapist for a specific client's needs. And we've really figured out that if you do that matching scientifically and really well, we can quintuple the number of patients that can return to full health. And that's really exciting for employers that care about their workforce, both in terms of productivity and quality of life.
Excellent. So how we're going to work today is I've got a series of questions and they're similar to both of you, but different because of your backgrounds. And then at the end, I would love to have you each share a slide on action steps that you want to give to the audience. And then we will open it for questions. So if you have questions, please have them ready. Dave, I'm going to start with you. When we talk about comprehensive mental health support in the workplace, what does that actually mean in practice? And what's the difference between a benefit that checks the box, and we've seen that with EAPs over all the decades, recent decades, and one that genuinely meets the range of needs?
So I think, when it comes to mental health, it's not a yes or a no, right? When we're talking about mental health, it's a continuum, and we all, fall somewhere on that continuum, and it changes from day to day, month to month, year to year, different experiences that we have. Everything from, folks who are looking to just build or maintain their mental health and emotional fitness, to times when we are all dealing with different life stressors, situational stressors, all the way through, more complex mental health or substance use needs, depression, anxiety, bipolar disorder, alcohol, substance use. So when we talk about, a full spectrum program, it's a program that can address the needs of employees and their family members across that continuum. Also a program that can help people step down to lower levels of care when it's appropriate. And one of the things that, as a clinician myself, that I've always tried to instill in my teams is that, our goal as clinicians or as a program for our, employer clients is, from a clinical standpoint, we want to, kind of put ourselves out of business as quickly as we can. We want to empower that individual. And so stepping people down to lower levels of care when it is appropriate to do so, using clinically validated tools to know the appropriate times to do that, it creates a situation where we can provide, tremendous value, good clinical service, but also in a way that's financially sustainable for employers.
Great, thank you. David, employers have made significant investments in improving access to mental health care, yet outcomes remain highly variable. From a research and science perspective, why isn't access alone enough? And what factors most strongly influence whether employees actually improve?
So let me answer that by asking the room a question. Let me give you some of the facts about how variable outcomes are, and then say how excited you are, ask you how excited you are about just improving access. 60% of behavioral health care that we're helping to empower our employees to get access to is ineffective or harmful. Another 25% is mildly effective, and the rest is very effective. And if those are the odds we have of just focusing on access, how excited are we of improving it, paying for more care? Anybody super excited to just focus on access? So from that perspective, we think it's important to focus on both. We need to improve quality because, as Dave has already said, if we get care right the first time, we put ourselves out of business, and that's really what our job is as a behavioral health provider. Is we can reduce the length of care, we can reduce recidivism. And since most patients in most forms of care relapse within a year, it's really important to focus on the quality as well as improving access at the same time.
So I'm going to ask you both the same question. I'm going to start with you, David. What does it actually mean to match care to need? And what are the consequences for employees and employers when that match is off in either direction?
Yeah, I think that's a really important question, because since our PCORI research was published in 2021, there are a lot of EAP providers that say they do matching. There's a lot of behavioral health networks that say they do matching, and maybe matching based on availability and people's demographic variables. You might call that matching. I really call those things filtering, because there's no science that shows that those things really help improve quality. So from our standpoint, it's really a scientific matching process. And the only thing that has been shown to truly move the needle is matching a patient's self-assessed needs by taking a routine assessment and matching them to a provider who's exceptional. Their recent outcomes using that same tool to track their patient over time shows that they're getting exceptional outcomes. That's the only thing that's moving the needle in terms of advancing quality.
Thank you, Dave.
I would agree with all that. Maybe I'll add some comments to the second half of the question, like on the impact if that matching isn't done properly, whether to the right level of care or the right provider. I think it costs employers, not just the individual, but the employers dearly on both ends, I think, of the acuity spectrum. When folks are, looking to build or maintain their mental health, or they're dealing with, daily life stressors that we all encounter from time to time, a bump in the road, a challenging relationship at work, things of that nature, a program that takes sort of a assembly line approach to, mapping every one of those individuals to long-term therapy for X number of sessions, because that's sort of the business model behind that program to drive revenue. It's really not focusing on resolution or creating resiliency. It's almost creating dependency on care, when we could perhaps address some of those lower level, lower acuity types of concerns through things like, mental health coaching, digital tools and resources. Even single session interventions can be very, very effective. So there's a cost there in terms of increased costs for employers for outpatient mental health. And on the other side, I think, and this is where kind of, I would say, traditional EAPs sort of get a bad rap, sometimes deservedly so, is taking a very transactional approach when someone, has a higher level need, where short-term counseling might be like tossing a toothpick at a charging rhinoceros, and someone truly does need a higher level of care, intensive outpatient, a more structured alcohol or substance abuse program. To have that moment when you've got, the opportunity to provide true advocacy and navigation to that appropriate level of care, and to instead just provide them with a list of providers that are in network that they then have to struggle with on their own to try to figure out who's going to be the right fit for me, and will I even get connected to them? And once I do, is this even the appropriate level of care? So many people fall through the cracks, and those types of situations obviously can escalate in terms of costs, crises, or people in need of, more acute services.
Thank you.
Yeah.
David, you've spent decades studying patient-reported outcomes and clinical effectiveness. How can outcomes data be used prospectively, not just to measure care after the fact, but to guide referral and treatment decisions from the outset?
Yeah, I think this is something that I've been top of mind for the last 35 years, as I've been thinking about how do we actually leverage the unique skills of behavioral health providers. We don't want to just be measuring it. We don't want to just be reporting and showing health plans. I'm talking to about myself as, for example, a talk therapist, to show retroactively I do great work. That's not nearly enough. If we're going to collect the data, if we're going to ask our patients to fill out something that might take 5 or 10 minutes to complete, it needs to be for them, and it needs to help me as the provider get better over time. And so figuring out how to use the data that's being collected to figure out what my strengths are. If I want to improve in an area that I'm below average that I thought I was great at, we need programs to be able to help people improve. And we certainly need to figure out how to optimize the networks that we currently have access to. I mean, the good news is that the data shows that most every network that we currently have can be optimized in a way that can really make it seem out of this world. And I just want to second some of the things that Dave was just saying. It's not one size fits all. It's not like everyone needs to talk to a therapist and it needs to be long-term or many sessions. There are many people that can benefit greatly from single session therapy, and some from potentially AI-assisted coaching and something like that. And we need better data that helps us drive people to that right process. And so having an EAP, for example, that has that full kind of continuum is really important.
Thank you. Dave, there's a window when someone decides they're ready to ask for help. How narrow is that window, and what should happen clinically in that moment to make sure it doesn't close before they get the care they need?
In my experience, it's shockingly narrow. Sometimes, and we may know of people in our own lives where this may resonate. People wait weeks or months or even years before they build up the courage or have the insight to see that, they're dealing with something that's impacting them and their families and their relationships and their jobs in significant ways. And, when someone ultimately has the courage to reach out and say, I need help, it's critical that first contact is as perfect as it can possibly be for that person, because there's ambivalence there at the same time. And if something is full of friction, or if something goes wrong, or if someone doesn't feel as though they're being, acknowledged or understood, that just gives them more reason to turn away, or, more often than not, people end up slipping through the cracks. So I think that window is very, very narrow. I would say it's even more narrow when we're talking about things like alcohol or substance abuse. There is a moment of clarity, and we need to strike when that iron is hot. For employers out there, who have alcohol or substance abuse policies or programs, maybe you have situations where that's identified in the workplace and you're referring folks into a program. You really want to have a partner who can make sure that we are honoring that person and helping them take that right step and getting them connected to the right level of care quickly, because that window of opportunity can fade. And sometimes, you lose an employee. You can even lose a person, if we aren't responsive to the needs in that person's precise moment of need.
Yeah, can I just second that?
Absolutely.
I completely agree that window for most people is very short. And it's one of the challenges. For example, we work with the American Academy of Family Physicians and many PCPs that think they have a great insight as to which of their patients is in most need of behavioral health care. The chances that those patients that are kind of pre-identified by their PCP as needing behavioral health care, you try to get them to care, the chances are much lower than those that self-identify and say, I need care. And so trying to drag somebody to care when it's not the right window, is the chances of that working is very, very low. And so we need to strike while the iron is hot and make sure that the friction, for example, is as low as we can make it.
Excellent. Dave, let's talk about the more acute end of the spectrum. Substance abuse disorders, which you just mentioned, situations where someone needs psychiatric support, cases where short-term counseling simply isn't enough. What does it look like clinically when those needs aren't met quickly? And what should explorers expect their mental health solution to deliver in those acute moments?
Yeah, so these are those situations which are, kind of lower frequency but higher severity, right? Someone who is reaching out because they or themselves are, suicidal, who have, a more severe mental illness or more of a crisis type of situation. I think there are a lot of point solutions and platforms out there that do a great job of, access, from the sense of it's easy to register on an app and it's easy to schedule an appointment within, 48 hours. But for folks who are in the situation that you're describing, I think a lot of times what people really are looking for is support in the moment. And so however you're offering that to your employees, I think it's a tremendous resource to have available to them, even if it's not the type of thing that every employee needs, to be able to know and trust that you have a program that within seconds, an employee can reach a licensed clinician for immediate support, whether it's 2 p.m. or 2 a.m, and that person is going to be there to help stabilize them, to put a safety plan in place, to, understand, what the best next step is, and then to hold their hand through that process, not to say good luck with that, but to actually actively manage that case and ensure that they're getting connected to the resources they need, regardless of whether that's care through the EAP or through the benefit plan or another resource that you offer. You need to have at least one vendor partner that is able to do that, because the consequence is that person really has nowhere else to turn. And, that's an unfortunate situation for all parties.
Yeah,
Excellent.
just to put a concrete number on that, last year, of those that called the 988 line in a crisis, the 988 system in some cases works very beautifully. They de-escalated 5 million people last year that were calling, saying that they were hopeless, thinking about suicide. And for many of them, there was nowhere for them to take the next step. Right. And so to Dave's point, we need to make sure that those resources are instantly available, because to keep that person de-escalated, they need care in that moment. They need to feel like there is someone that they can schedule with, that they have an appointment with, that knows what they're going through and has the experience to help them with those needs.
Thank you. David, and actually I'm going to ask both of you, but I'm going to start with David. David, we know mental health and chronic physical conditions are deeply interconnected. What does the research tell us about how improving mental health outcomes can influence broader health, workforce functioning, and chronic condition management?
Yeah, so let me start answering that by being emotional about it for a second, because I don't think there's any other field of healthcare where we need to show the ROI. We need to show that it's reducing medical costs by investing in people's well-being and behavioral health, right? We wouldn't do that for cancer. Does having a cure for cancer, what's the financial ROI before we lean into that? So part of my angst about hearing those kind of questions from the general community, and especially from health plans, is we shouldn't have to answer the question. Yet, the data is there. I don't think there's any other field of medicine, any other intervention we could be doing than solving people's chronic behavioral health problems that are overlaid with serious medical issues as well. 90% of those folks have more than one behavioral health problem that have a chronic medical problem. We need to get them to the right care, and the data shows that the ROI in terms of reducing their medical spend and getting them to a good physical health place is extremely powerful. The thing that has gotten in our way is how do we scale delivering exceptional behavioral health care outside of a narrow band of, like in a research study.
Thank you. Dave.
I think your experience, David, probably trumps mine here, but I can speak from the perspective of my organization. So we not only offer behavioral health services, but we also offer wellness services, more traditional wellness services. And I can tell you that for the clients that we serve that have our integrated offering, both EAP and wellness, the opportunity for integration of those two programs is unbelievable. Like when a health coach is working with someone on, weight loss or behavior change, and they identify that someone is perhaps stuck because there's an underlying, mental health challenge that could be addressed through therapy or counseling or even mental health coaching, to be able to seamlessly make that transition actually, helps us kind of address both those problems at the same time. And on the other side, oftentimes we are working with someone who is dealing with depression or anxiety, but part of the underlying what is driving some of that is an underlying physical health concern or a lifestyle issue, and so being able to bring in a health coach to help them there, so you gain synergy that leads to good outcomes and it shouldn't be a surprise, right? Like our brain is inside our body, they impact one or another. And I'm not a doctor, I don't know if it's a chicken or egg, like which comes first, but there definitely is that connection there. And what we see as a result is just higher levels of engagement in both sides of the program when the two are integrated.
Excellent. So Dave, the next question is for you. And by the way, it's snowing, just so you know. Can't see it outside. It rained
That's
last night.
Chicago. You never know.
Rained and hailed.
Yeah.
So
And it was 70. It was
So-
70 2 days ago. So
that happened 30 years ago on my wedding day, and we have not been married for 30 years. Anyway, Dave, the EAP is often siloed. Medical, pharmacy, safety, disability, and leave management typically operate separately.
Yeah.
What does it look like when it's genuinely integrated into that broader ecosystem, and what becomes possible when those pieces work together?
yeah, I think for far too long, I'm not going to say all EAPs, but many EAPs sort of became this one benefit that kind of sits in the corner all by itself, and we're here if you need us. And you know, you're never going to maximize engagement with that type of approach or a strategy. You know, a true workforce mental health partner is going to help you as a benefits leader identify all of the different opportunities to integrate with the other components of your overall population health management strategy, your other vendors, disability, you know, workers' compensation, your safety teams, your wellness program, because there are so many opportunities for integration. I mean, think about just disability in and of itself. Anybody who is going out on a disability leave could benefit from the EAP. Not even because most people who are on a disability have a mental health problem, but there's some sort of underlying stressor there, whether they're caring for their own health concern or a family member's mental health concern, even if it's just work-life support or coaching. Like, there is opportunities that are left, you know, on the table when the EAP is not integrated into your overall strategy. And if you have a true partner, your EAP should be pointing that out to you and really helping you identify those opportunities so that you can really increase the value that you're getting across all of your benefits.
Excellent. This next question is for both of you, and I'm going to start with you, David. For employers designing a comprehensive well-being strategy, what scientific signals or evidence should they look for to distinguish the programs that are likely to improve outcomes from those that primarily focus on engagement or access metrics?
Yeah, I think this is really important. And sadly, it's almost like you need a PhD to distinguish what's really scientific versus vaporware or the smoke signals that come out of some vendors and thoughts. But the research shows that the only thing that really matters is, like I said before, matching on this outcome-based process. If you look at the research and publications from a lot of folks that are out there, they're not controlled research. There's not randomization of patients to one group or another. There is not another type of vendor or process we're benchmarking it against. And I think those things get us into trouble. So for example, who's heard of CBT for behavioral health? Most everybody. It's the most celebrated talk therapy out there. Its research and controls at the very beginning, and probably for the most part, we're comparing to waitlist controls. We're comparing things to no treatment. You need to benchmark what you're looking at compared to something that's working as well as what you currently have, not something that's almost nothing. So for example, in the same way, when we look at the outcome research on SSRIs and drug therapies, we're comparing them to placebo, right? I think what you want to look at and benchmark what you're thinking about doing compared to what the best practice you currently have now. And so I think that's the most important thing to look at in terms of the science. Show me that this is working much better in a controlled study than what I'm currently have available.
So I didn't see how many people raised their hand. EBT is evidence-based therapy, and you probably all know that, but in case you don't, I didn't for many years, so I just wanted to level set. Dave, how about you?
There's not much I can say to augment what David has said. I mean, he and his organization are paving the way, and they're making organizations like mine better by the work that they do, and we follow closely and replicate as best we can. But 100%, like, I think the days of, you know, measuring the success of a program by, you know, engagement, you know, the number of people who are using a program or satisfaction, you know, those are certainly, you know, metrics that are good to take a look at. But at the end of the day, you want to, I would think that most organizations are most focused on what is the actual impact that this program is having on the health, the well-being, and the productivity of the folks who use it. So, you know, we do the very best we can to provide that information to our clients in a very transparent way. The nice thing about, you know, investing in building that into our processes, you know, getting those baseline measures and following up to see, you know, how we did by using those evidence-based tools pre and post treatment. Not only does it allow us to optimize the care plan for each individual and make sure folks are connected to the right the right care initially, it also allows us to report back on the impact of our program on things like, reduction in symptoms of depression, anxiety, the percentage of employees who are abusing alcohol or using at risky levels, employees, reports of productivity or absenteeism. So I think it's very, very important to look beyond some of the traditional metrics and really ensure that your workforce mental health partner is helping you understand the actual impact it's having on your people.
I think we have gone, whether COVID was part of the driver, I think it was, but we've seen significant improvements in the program and product offerings and the knowledge level and benefits managers and directors better understanding what they need to do. When it comes to critical situations of our members, does anything come to mind to you that maybe wasn't talked about today and should be part of that equation? I know it wasn't part of what we discussed, but I think it's an important element so that these benefits folks can go back and say, I never thought of that. And it's okay if it's an even simple one.
No, I think, I would go back to, so I think what COVID did, and there actually were some good things that came out of COVID. I think it raised the awareness of these types of challenges within our workforces. I mean, there was the day when, part of my job was to, support the sales team to help, convince employers that there actually is a behavioral health need within their population. I think like those days seem to be behind us, and everyone recognizes that these problems or challenges are inherent in every workforce. A lot of what we used to solve some of the challenges we faced during COVID and shortly thereafter were very, very heavily focused on technology. And I think that's great. And technology expands the footprint of the program, and it engages people who might not otherwise use a workforce mental health program to use it. But I think it's also critical that we remember that the human-centric aspect is equally as important. And, in order to have a program that appeals to all people, we need to ensure that there's choice in how people access and receive care. Having been in mental health my entire career, like if there's one thing that I have seen is that when it comes to mental health, choice is always going to be part of the cure, because if people don't have ways to access care or receive care in ways that feel comfortable and convenient and culturally relevant, a lot of times they're never going to reach out in the first place. And I think that's especially important in those critical moments.
Thank you.
Just real quick, I agree that COVID helped reduce the sense of stigma, and that is a positive thing, and hopefully that continues. But the thing that comes to mind in answering your question is the power of you're all working together. And I think that's missed in trying to push the field forward, remember the power of all of you working together to push the industry towards what you think it should be. You have a lot more power than you currently worry that you do when you go to a vendor and say, can I have this?
Using the employer, using their voice.
And your coalition. To
And
work
the
with you to help.
coalition and
Yeah.
bringing educational, this knowledge and information to the employer community.
I love that you brought that up, because that's so true. And we've even seen it within our own organization. Like there are organizations that we serve that have better ideas than we've come up with, right? And so to partner with an organization to try something new or do it a different way, like that is super exciting. And then to be able to measure it and, hey, this actually works. And selfishly, that helps us say, hey, we've got this new thing that we can do now. Like the clients that we serve and support are sometimes the greatest generators of new ideas and ways of doing things. So you all have wonderful ideas to share with your vendor partners too, and you should speak up.
And we've got a few of those employers in this room that have said, hey, I really want to try this. Let's pilot it. And then it becomes a program or a product. And I think that's wonderful. There's a lot of new vendors in this space, vendor partners. What is the one question every employer in this room should be asking them that they may not think of on their own to ensure that that is the right partner for them?
Um,
Go ahead.
sure. I'm trying to think of one question that would sum it up, but given the conversation that we're having right now, how do they determine what care is appropriate for each individual who uses the program? I think, I'm trying to think of a question that would bring us back to like, how do you determine what is clinically appropriate care? Is it an algorithm on a website? Is it a licensed clinician? Is it a combination of the two? But at the end of the day, like I truly believe that the only way that a program is going to meet the needs of all stakeholders, the employer, the person in need, and at the same time, the organization who's providing that service is doing the right thing for each unique individual, providing that clinically appropriate care, again, the right care at the right time for the right amount of time, focusing on resilience and getting people back on their feet quickly, but also having, the depth to be able to support people who truly do need that more ongoing care or higher levels of care.
Additional thoughts?
Yeah, for me, it's all around the science. Yes, the number of vendors out there are exploding, but also the science is leapfrogging ahead quickly. So to me, the question would be, show me the science you're following. You don't have to be the expert on it. Let them be the expert. Show me the science you're following and how you're leveraging what you do for me based on that science.
Thank you for letting me throw a couple extra in there and stepping up to the plate. I'm going to turn this off for a second and then come back to this one. We did ask both of you to put together some action steps, and I'm grateful that you both did. I think I'm starting with you, Dave. So are these them, and can you walk us through it?
Absolutely. And just so everyone knows, I'm told that this is also available in the app. Paula clarified that. So if you are in the app, you can just click on the little link. I think it might be beneath my picture or my name, and you can see this. So don't worry, you don't have to scribble it all down. It's all there for you. And I think it speaks to what David was just saying. You have to ask those questions, and you have to kind of kick the tires a little bit to understand. I would encourage you to audit your vendor. To ask those tough questions. Who are the folks on the other side of every access point into the program? What types of clinically validated tools are being used to determine, who is the right provider or what is the right level of care? How long, do you stay engaged with that person to actually confirm that they're connected to care? And are you measuring those outcomes? So asking those questions is really going to help you determine pretty quickly, whether this is a program that is looking to just check a box or whether they are a true partner that is invested in delivering value and outcomes to you and your organization. We talked about mapping your benefits ecosystem and looking for, there are so many point solutions out there. And I feel a lot of times what's happening is, or what we see happening is employers have an EAP or a program that maybe isn't doing all that they feel they need it to do. So they try to fix that by adding point solutions, and you end up trying to glue things together that don't really work well together. I think it's very, very important to challenge your workforce mental health partner, before you start looking at point solutions. Hey, how can you integrate with our disability vendor? What can you do with our wellness provider? They should be providing those recommendations to you. If they're not, you need to ask them about that. And then I think we've got a couple more. I'll be quick. I know I'm being cognizant of time here. 3 is tricky. Because behavioral health spend shows up in lots of different places. Obviously, the first place everyone looks is, their claims data. But also be mindful that it shows up in other areas as well, especially if you are, if an organization is partnered maybe with a more traditional program that isn't getting the type of engagement that you're hoping for, chances are those costs are showing up somewhere else, like workers' compensation, safety, disability, and the like. And then finally, you need to ask your program very, very specifically, what are they doing for those situations where an employee or a family member is in one of those high risk, high need moments. What you don't want to hear is, well, that's outside of the scope of EAP. And in that type of situation, we guide folks to the benefit plan. If you hear an answer like that, it really just means that someone's reached out in a crisis and they've been told, I really can't help you, but here's the number for the benefit plan. You need something more. That's not going to help a person who is in one of the situations that we were talking about earlier today. So I'm being brief, and I'm happy to talk more about any of these with any of you later on in the day.
Thank you. And David, I've got some action steps from you.
Sure, and I'll be very brief because this is the focus of what we have going on here that we're co-sponsoring tonight and tomorrow, is thinking about how do we turn the science that we've created into something that employers can use. We've created an action brief that's available to all of you. You're all welcome to join us tonight and tomorrow as well. We've organized it into 4 different categories on the kind of questions that you should be asking your vendors to make sure that they're following the latest science on these points. The handouts are available both at our booth and folks to get tomorrow. So we're happy to dive into the details with you.
And I want to just bring up something that I think you mentioned it earlier. I heard it from you last night at dinner that our employees accessing care, but not consistently getting better. And because that keeps you in the loop. And there are many therapists that work in that mode. So very important.
I mean, it is one of the problems. Just because I like my therapist doesn't mean that they're the right person for me.
Right.
Languishing in care is a real problem. Continuing to see somebody for a long time, not getting the outcomes we want is not something that as an employer, we should be excited about paying for, right? We want to get people the help they need, get them the relief they're working for. And as Dave started this entire conversation out, our job is to put ourselves out of business almost like a good parent does. We want our kids to grow up and not be as dependent on us as they used to. That is our goal.
We have time for questions, but before we do that, just a quick question. Based on everything that you've shared and the stakeholder role you play in this, what are you excited about in the future? And Dave, I'll start with you.
I am excited about a lot of things. I would say
Related to this topic.
related to
Not the snow.
yeah, baseball is just right around the corner, spring training. No, I am excited. I'm excited about the ways that employers are challenging their vendor partners to think bigger and helping their vendor partners to help them solve their unique business needs. Many of the organizations that we serve have very unique business needs that we've been able to partner with them and tailor our program to help them not just address those problems in a meaningful way, but also, be able to demonstrate up the chain, like, here's how our vendor partner is actually helping us solve, problem X that is on the company's radar. Like, to me, that is really, really exciting and allows our teams to be, creative with our clients as well and do bold, exciting new things.
Excellent. How about you, David?
Yeah, very similar thought. I'm most excited about seeing the power that I believe is coming as employers come together and push the field forward. For a long time, health plans has said in response to show me the outcome data, show me the stuff that you're on the cutting edge of, it's too hard to measure kind of response to things. We're showing that's absolutely not the case. It is possible to measure. It's possible to use it to dramatically improve outcomes. And as you'll learn tonight and tomorrow, our app is free. So to tell a health plan it's possible, it's easy to integrate, it's a lot easier to push the field forward and say this is the right thing to do. And I think there's a lot of power and leverage that will come from employers pushing for the right thing to happen.
That's a great price. Yeah.
I think we have time for a couple questions. Does anyone have a question? I see one in the back, and do you have one online? Let's take the one virtually first, and then I'll come back to you.
Okay.
So online, we have just a comment that we try to connect as many of our partners as we can, but it's not something we really follow up on or do check-ins on. So they just appreciate this as a good reminder to make sure that those are still relevant connections and are being utilized. And then another question from a virtual participant. Are there medical diagnostic data categories you see substance use disorders showing up when SUD is not specifically identified? So where else, what other, diagnosis is it showing up in?
I would say that almost all people with complex, high-cost medical claims, more than 85% of them have an undiagnosed behavioral health problem that's interfering. So where does it show up the most? It's in your highest cost claims. And just think about the stress that one has to deal with in going through whatever that major medical problem is. It is not abnormal to be dealing with anxiety, depression, sleep problems, and having trouble listening to your doctor saying, this is what you need to do to stay alive or to keep your foot from being amputated. You feel like you're being given a death sentence, and there's good reason that you're feeling anxious, depressed, whatever it is. And again, it's the only field of healthcare where I believe we're trying to not say that it's normal. If I was in a car accident and had a broken leg, of course I need it in a cast. Just because I understand why I have a problem doesn't mean I don't need care and support for the stress I'm going through. And so where does it show up the most? It's your highest cost medical claims is where undiagnosed behavioral health issues are showing up.
Dave, real quick response?
Yeah, I just would comment on the first comment about, the frustration with, not being able to connect the vendors. I think the approach that's often been taken, or that I've seen taken, that doesn't always work is sort of the vendor summit, where you bring all your vendors together once a year and you powwow and you kind of talk about all these great ideas, and then everyone goes and nothing really happens, right? Like, it has to be more than that, but you can't do it alone. Like, you need to identify vendor partners that right from the onset, this is going to be a focus for them because it's part of their overall engagement strategy for the program. It's something that you should vet out early on when you're looking at vendor partners, because you want to ensure that you have all providers who are willing to, again, like, not just walk the walk, but talk the talk. Or not just talk the talk, but walk the walk.
Got it. Last question?
Okay, thank you, Dave and David. I have a question for you about that window of opportunity, especially with SUD and for us as managers. And I kind of want to pull on a thread of something that Claire said around so much of this can happen at work. So is there any training or advice that you would give to managers of people that often we will encounter that person who has a substance use disorder in a workplace setting, and what as leaders we should do? And I've had that scenario myself and I feel good about what I did, but I feel like I want more training, and all of us should have more training on that.
Absolutely. And I know we're kind of running short on time here, so I'll be super brief, and then I'm happy to talk with you about it later. But first off, kudos to you to handling the situation. And it sounds like it went well, but a lot of managers, they want to do the right thing, but they don't know what to do. A good workforce mental health partner will provide manager training on that specific topic. And it doesn't need to be the type of thing where we pull people offline for 2 days or a day. Even an hour of mental health first aid basics can teach people and managers how to identify someone who's struggling, how to connect them to the appropriate resources, and how to do it in a way that it protects the confidentiality of that participant. Your program should also offer consultation to managers in those situations if they forget how to do it. But this is the kind of stuff that can create champions of the program and drive even higher engagement. And believe me, once alcohol, substance abuse problems are showing up in the workplace, it is a significant problem. It's usually the last place it shows up. Like, it's the part where they're still holding on, and if it's showing up in the workplace, that chances are it's impacting other areas of their life as well.
There's nothing I can add to that.
That's okay. Let's thank this fabulous panel here. Stay there, and I'm going to switch up to break and we can come down. So we are now going to move to our last break of the day. I want to thank again all of our sponsors. Please visit them. We will have a 20 to 25-minute break now. Please make sure to turn in your prize drawing cards. Actually, it says 2:05. Make it before 2:05. We'll get back to our program. Go have some fun. Welcome, Paula. Introduce yourself.
Hello, I'm Paula Sheehan. I'm the Director of Member Engagement at MBGH. I've been there about 2 years, and I will say I feel very blessed because my boss, the one that was just speaking, Cheryl, asks me quite often if I'm doing okay or how I'm doing and what she can do to support me. So we have a very good work environment at MBGH. Okay, if anyone has a prize card that is mostly filled out, feel free. This is your last opportunity to drop it into the prize drawing. So we appreciate you visiting whatever vendor partners you did spend time with, and you can drop your card off in the box. Okay. Moving into the last half of our day. So I'm pleased to present our next speakers. We're going to start off with Tara Sherman. And Tara is a member of the Total Rewards Global Benefit Strategy team at the Boeing Company. She leads the development and execution of mental health and well-being strategy worldwide, ensuring inclusion of local market practices and culture. She's a valued member of our board. She's also the vice chair. She's very thoughtful and insightful about what she shares in their journey, her, key takeaways and experiences along the way. She's so, we appreciate all of her commitment and dedication to supporting us and our board as well. Tara is going to start us off, and then in a little bit, we'll have Janet Pajamulu. I think that's pretty close. I asked her right before I came up here, and that's how quickly it went. Janet is also joining us from the Boeing Company. She will be coming up for a fireside chat following the presentation. She's a strategic human resources leader with 27 years of HR experience across manufacturing, healthcare, corporate retail. She's currently the HR Senior Manager for the 737 program at Boeing Commercial Airplanes. When we did our prep call, she has this really big window behind her that you actually see where they're making the planes. It was very cool. So she's accountable for HR strategy and employee relations for more than 13,000 employees across the Renton and Seattle, Washington sites. So Tara wanted to start off with a poll. If you could pull your phones out, we'll have a poll here and then a couple more polls later. So the question she wanted to know is, what type of EAP does your organization have in place? So traditional, innovative, combo, no EAP, or you're not sure. So I'll give you a minute to get your phones out, but I will say the Boeing Company and these two ladies, as I prepped with them, are really striving for an innovative, comprehensive mental health, strategy as we started our day off, not just offering more and more, but filling those gaps and widening and deepening the support that is available. So let's see if results are coming up here. So pretty evenly split between traditional and innovative. Oh, a little bit of a shift, more traditional. Oh, I know. Yeah, and it's a little bit slower because of the building, but so okay, so now you know where people stand. I'm going to invite Tara up, and if you could please share with us your one small habit that helps keep you centered and steady when life gets crazy. So welcome, Tara.
Hello. All right. My one small habit that I prepared to share is all different breathing exercises. And know we started the morning with Chase with box breathing. I'll do that sometimes. Sometimes I'll do the inhale with the longer exhale. And sometimes I'll do alternative nostril breathing. If you can't tell, I did some yoga training. And that's where all these different types of breathing come from. But the thing I love about the different breathing exercises is you can do them anywhere. Sometimes I do them at night if I'm having trouble shutting my brain off. I was sitting in the chair doing them a few minutes ago as I got ready to come up here. So it's available anytime, and that's one of the things I love about it. One thing I've just picked up, I think, is this little fidget thing. I think this is also helpful sometimes. So a couple things there. I wanted to start off first by saying I always love being here in the room with all of you. I think getting to see some past colleagues is really nice. Getting to spend time with my current colleague is amazing. We don't get face-to-face time all the time. And many of you are becoming friends and just experts that I quite frankly rely upon and learn from. And those of you on the phone, thank you for being here too. I know it's not always as easy to hang in for the whole day, but schedules are really hard now. So MBGH, I think, has done a great job of making it work for each of us, however that looks that day or that month, because it changes. This morning, I really appreciated from a professional perspective hearing from our experts. From someone preparing to speak in the afternoon, I want to share a couple things that I truly appreciated this morning. One was the emotional labor that Doug talked about as you prepare for speaking in an event, because I think all of us are so passionate about our work and take it so seriously that we want to make sure that it means something when we're up here. So I put a lot of pressure on myself for that. And when Chase and Doug said, okay, but as long as you take one nugget today, then that's what we're going for, and that's meaningful. And that's what I hope when I listen to someone, and I've got it from every speaker and panel today. And so I hope I'm able to do some of that for all of you. Also, when Claire was speaking about the foundation, she really laid out like what the landscape looks like now. What does mental health look like? How has it changed for employers? I think we saw some of that in the poll. There's been so much movement in the market in the type of EAP support that we're offering to people. So I hope I can show you how we've attempted to bring some of that to life. We're clearly not done. I think for most of us, this feels like such an enormous responsibility to keep improving and bringing the benefits to our people and the business. But I'm really proud of the work that all of us in the room have been doing here, and hope that I can share some things that connect dots for everybody today. Okay. So I'd like to begin by just giving a brief overview of our company. Most of you have probably heard of us. The Boeing Company is a leading global aerospace company. We develop, manufacture, and service commercial airplanes, defense products, and space systems for customers in 150 countries. Boeing employs more than 140,000 people across the United States and in more than 65 countries. And in fact, we just completed an acquisition of one of our suppliers, adding another 15,000 employees to our workforce. Innovation is really a key driver in our work every single day, and we solve some of the most complex challenges out there from the sea up into space. We're organized into 3 business units. So most of you have likely heard of commercial airplanes. That's where Janet works, and it's the planes that we all take to get on vacation or to get to this meeting. We have defense, space, and security, and they're responsible for products that keep the U.S. and our ally countries safe and protected. And then Boeing Global Services, all the products and services that are needed after a product leaves our factory for its lifespan. So simply put, Boeing's mission is to connect, protect, and explore the world through aerospace innovation. The fact that we're focusing on mental health still, and I say still, I know it's a fairly we're seeing a lot of positive shift over the past few years, but some of the other speakers mentioned the dramatic shift we saw during COVID. So the fact that this didn't fizzle after we came out of recovery from the pandemic really fills me with optimism. We've heard from some of the best minds available on this topic today, and I'm hoping we can keep improving things for every person that needs them around the world. And while that's a big nut to crack, each of us can make a measurable impact in our own populations, in our own line of work. And I think that motivates each one of us for what we do every day. Why Boeing prioritized mental health is likely similar to other employers. First and foremost, we care about our people. Life is really hard sometimes, and people often face more than their fair share of trials and tribulations. You probably know individuals who you think they keep getting hit. And while we can't control those events, we can do everything in our power to have resources available and help people when life happens. Mental and physical health are connected. We heard a bit about that today also. Poor mental health can affect physical health and vice versa. And so that's why we've focused on solutions that support the whole person. And I'll share an example of that when I walk through our resources. Safety, as you can imagine, is central to everything we do at Boeing. Some team members work in confined spaces, others use safety gear while they're painting or assembling aircraft. Every action must support product reliability and safety for our teams and our customers. And to do that, our people have to be laser focused on the task at hand. So ensuring care when employees need it for us is really a business imperative. Keeping great people matters. Benefits aren't just a market differentiator. They're how we help our employees succeed in life and at work. By offering mental health support and other solutions for life challenges, things like reliable backup care for kids, adults, and even these days pets, we remove barriers so people can meet their needs outside the workplace and come to work, show up, and be ready to contribute. Productivity depends on support. We need to deliver top quality products and they need to be delivered on schedule. The best way to do that is with a workforce that can be their best every single day. And on days when that's not possible, we want employees to know that there's resources available to help them take care of themselves. The bottom line here is we prioritize mental health because it's the right thing to do for our people and it's essential for safety, retention, and performance. Before I dive into a couple of our key priorities, I want to share our mental health ecosystem. We've long believed in the need to support people through the entire continuum of care, from staying emotionally well and building resilience all the way through moments of crisis. Around 2016, we introduced a brain health tool. This is app-based and it's quite gamified. So it's really great for those individuals who don't want to talk to anybody. Do you have any of those around you? I don't want to talk to anybody. I think it's getting better, but we certainly over the years have heard that. And it's also a really good resource for individuals that don't need to talk to someone and just want to stay healthy and be proactive. The focus of the tool is on things like memory, cognition, emotion regulation, negativity bias. I kind of think of it as mental fitness. Over the years, the tool's grown. It now includes breathing exercises that kind of follow along with it. It has meditations and really short tidbits of information on emotional health that people can choose to look at their leisure. The impacts have been validated, and it's been really inspiring. You know, some of us as global employers really struggle with solutions that are available around the world, and this one is. And we've had some really lovely stories come in from all different regions, sharing how the tool has helped them at different points in their life and for different reasons. At other MBGH events, some of you have heard me talk about our condition coaching and management program. Coaching and Condition Management Program. Sorry, I need to double check I said that right. One provider for all condition management for diabetes, for weight and obesity, hypertension, all of those conditions you can imagine, all in one place. And what we did a few years ago is we looked at the results of those in a weight loss program who screened during onboarding as someone who would benefit from mental health support. And then we looked at the difference in weight loss for those that accepted that mental health support and for those that did not take the mental health support. And we discovered that those that needed it and accepted it lost twice the amount of weight as those that didn't. So just earlier, actually, I think more than one speaker talked about the connection between physical and mental health. We heard a couple of our speakers talk about that upset tummy and that what happens in the gut. They are absolutely connected. And I think we're going to see more and more of this connection being made. So for us, even when we brought in what Claire called EAP 2.0, I've called it innovative EAP at different times. Even when we brought that in and it offers mental health and life emotional coaching, we still kept the mental health coaching with our condition management program because everything's in one place. Somebody doesn't have to download another app. They don't have to onboard somewhere else. It can all be in one place, and we've got the results to prove how successful that is. So on the topic of our innovative EAP, we added that about 18 months ago, and I'm going to do a bit of a deeper dive on that and the next two topics in just a few minutes. So I'll carry forward to our medical plan and what we've done there. We've worked specifically with our medical plan for several years now. This began years ago by taking what was at the time was carve-out mental health, which just seems unimaginable now at this point, and bringing it back into our health plan. Then at that point, we worked really closely to make sure that we had capacity, provider capacity in really critical areas. So think about ABA therapy. Where are the regions we're at? Where are our people? And what do the providers look like? And work with our health plan to well, they did the recruiting, but we partnered to share the importance of having the capacity available in these regions. We did the same thing during the opioid crisis with MAT providers, making sure that we had enough providers available to meet any needs that would come. After that, before launching our newest EAP, we also worked with the health plan to develop behavioral health navigation. So, you know, on the last panel, we talked about the importance of quality, and that is so important. I'm really excited to hear where that's going. I think that that is going to catapult us. But quite honestly, a couple of years ago, we couldn't even get people a therapist, whether it was effective or not, or people were waiting for 4 months. And so we knew we had to do something, and we were still in a traditional EAP arrangement. So we worked with this health plan in order to create this navigation internal to where our employees could call. The navigator or the customer service agent would learn exactly what their needs were. They would go out, they would find providers, whether it was virtual or in person, and they would ensure they were taking new patients and that they could see them in a reasonable amount of time. And then if the employee wanted, they would even make that appointment for them. We found most of the time the employees just wanted the provider that would take them, and they would go make the appointment. But that turned out to be really helpful. We also track utilization in our major markets. We track things like on a monthly basis, things like levels of care in mental health and substance use, and network utilization, how much in-network versus out-of-network is happening. And so we look at this so that we can see what's happening within our population and do we have any gaps we need to solve for. And while all of these programs are critical, I think culture is equally important, and we've heard that from a lot of the different speakers today. And impacting culture is not simple. Our workforce is geographically dispersed, work schedules span 3 shifts, and many employees don't use a computer daily. So when they're on a computer, often it's a shared computer that they'll get on to look at company news or perhaps complete some required action that they need to. So that really shapes how we communicate and engage our people. Over the past few years, that communication has really shifted from reluctance to openness. And I think, again, we heard a lot of how the pandemic put us in this position, and a lot of us didn't have a choice. We had to respond at that point. But I think it's been so fulfilling, I think I'll say, to see that shift happen in real time. We now communicate about mental health. We share real employee journeys, and we talk about topics that were once taboo. We actually talked about medication use in one of our articles. One of them, religion and faith, came in. And I remember getting these articles for review and thinking, whew, I know by the time this gets published, this is going to change. And it didn't. I mean, maybe small pieces, of course, but overall, we kept those messages and we told people's truth and their stories of what helped them. Our communication team has actually amplified this approach because it worked so well. So now they're starting to highlight employee stories that show how multiple benefits can work together. For example, we have a teammate who trained for an Ironman. Has anybody in here done an Ironman? That's amazing. One person, but still, it's just, I can't even fathom. And I did used to be more athletic. So this individual was training for an Ironman. So he took advantage of, you might imagine, virtual physical therapy, but also our coaching and condition management and our innovative EAP. So that weave together was really powerful. And I think helps other employees see how they also could take advantage and see some of these resources in their lives. We offer targeted webinars and trainings on practical topics, things like keeping kids mentally well, meal prep for busy professionals, sleep, and our supplier partners bring in subject matter experts to lead the sessions, and then they share the resources or how to engage with the program at the end. Local sites also can spearhead programs to meet their needs. Our largest locations have dedicated well-being focals. Most of them run a fitness center and then are also responsible for weaving the well-being culture throughout the site. A popular initiative that has really rose in use in our workforce is therapy dog visits. We coordinate these with a nonprofit and usually a small site contribution. And it took effort to get approval. And I'll tell you, when the idea first came up, we thought of probably 42 reasons why we would not get approved to bring therapy dogs to the workplace. But we stuck with it and we were able to get approval, and it's really taken off. We've had such a positive response. Dogs make a lot of people smile. They lower stress. And for some that it doesn't, we give advance notice. They're in a contained area. We don't want anybody to have an allergic reaction or be fearful. So, we do, of course, manage it for the workplace, but I will tell you, these are my favorite photos to receive back. You just see happiness and light in people. Our larger sites also have on-site counselors who provide in-person therapy and help foster a stigma-free culture through awareness and education. They really become a fabric of the site. And then our Mental Health Ally program has created a trained network of mental health champions in the US and the UK. So this is pretty similar to other well-being champions that many of you may have in your workplace or have had in the past, but it's with defined training requirements and a clear role supporting colleagues. They don't do any counseling, and we have really defined boundaries in place. I'll speak a bit more about this program in a minute. So in summary, we prioritize investment in our benefits, but also in communications and local activations so that employees can get support when they need it. And we're really working to build this into our workplace culture. So let's talk about some of the 3 key priorities we've been working on. There we go. We knew we had to do better than, we knew we had to do better than the EAP we had in place. It was mostly telephonic. When employees called for help, they got a list of network providers, and then they were off on their own to see if anybody was taking new patients, to see if they could get an appointment this week or this year. And it was just a really difficult experience, especially when you think, for many of us, what it takes to get to the point where you call in and say you need help. So we just knew that that wasn't providing either the accessibility or the quality that we wanted to offer. So after a competitive RFP, we selected our new provider. We launched in July of 2024. And then after that, we rolled out in 5 phases to 65 countries. We just finished last month in the Middle East. So a few quick highlights that I think make this a differentiator for our employees and their families is having both virtual and in-person care. A surprise to us a bit was that 80% of our employees choose virtual care. We worked hard to make sure that there was in-person care and that there was enough numbers in places depending on our populations, but we've seen employees really adapt to the virtual offering. The program offers both coaching and counseling. So on the panel, they talked about getting people to the right level of care. It's not always more therapy and more counseling. So through onboarding, employees are triaged and recommended a path, but they always have the ability to choose the support that they prefer. Through this program, people can also get support for medication management. 2 of their allotted sessions can be used for that. So if someone is just starting or they may need to find a new provider, it can bridge that gap. And that's really important. If anyone's ever tried to find a psychiatrist, that's one of the only things harder than finding a therapist. So it can be really, really difficult. And we're really proud that this is available. We have on-site counselors. We had them before this program. We have continued that. They have dedicated office space so people know where to find them, as well as providing in-person appointments and support during local circumstances, team meetings, and of course, critical incidents. Because we're very large, we are fortunate enough to have a dedicated management consultant team. So they are dedicated to our account. And when our HR team or our managers need support, they can reach in to one of these specialists that know our business, our culture, and our practices. And often in an HR role, employees will reach out for help. And, I'm sure this happens to Janet. I know it used to happen to me, where it's not our area of expertise. And you don't want to make a mistake. You want to help them as best possible. So I call this consultation line a resource for the helpers to get that support that you need to then support your workforce. And lastly, our team has really come to rely on critical incident support during those really difficult moments probably all of you in the room have experienced in your workforce. And knowing that you have an expert that can come in and help guide and support employees has really been amazing and a differentiator for us. So over the years, we've seen some good numbers over the 18 months. And we're happy with these. Now, this is activity so far. So we've got 13% enrollment, which I think previous EAP, and we were a standout, I think we were at about 5%. So we're really thrilled to see how much we've grown there. 60% of those that go through onboarding book appointments. We're happy there. And we continue to get about 1,000 new enrollments each month. The management consultation team has handled 2,000 requests in the past 18 months. It's less than a day most of the time to get an appointment. And we've had over 120,000 coaching and counseling sessions. So those numbers we're really happy with. But I do want to say, the metric that I think means the most to me is one that was shared last week with us from our partner, and that's that employees and families that have received care for anxiety or depression have reduced their symptoms by over 80% on average. So when we talk about quality, when we talk about outcomes and making a difference, all of these are great because we want to get people the care that they need, but that's really why we're doing this. We're doing this to help people feel better and live better. All right, one of my favorite topics the past year has been substance use disorder. We've been diving into this topic for a few reasons. One is our fraud, waste, and abuse partner flagged some what I'll call curious practices from substance use disorder providers that needed closer scrutiny. Our out-of-network spend was really far above benchmark, and we want to ensure people are getting quality care. We also know that people often struggle when a need for substance use care is identified. It's an acute need. It's often a very emotional and difficult time. So what do people rely on? Recommendations from friends, ads they've seen on billboards or TV, or often sources outside the medical plan. So we added the substance use program as a buy-up from our EAP 2.0, and it has a few important components. One, there's outreach to everyone identified as at risk through coaching or therapy appointment, an onboarding assessment, a care navigator, or even a referral, and they can self-refer. Outreach is made to everyone. There's a specialized care navigator that specializes in substance use disorder, and they help the person find the right care and then are there available. That person, not a phone line, but that person for the full year. There's a spectrum of programs available. I think a big learning for me in this area has been that I think often I would think about substance use disorder treatment as getting into detox and staying in a residential program for a month. And this area, I've learned more about harm reduction and reducing the amount, for instance, of alcohol use. And so there is a big spectrum of help that's out there for low to moderate acuity, starting with coaching, a lot of virtual options. And then if there is a higher need, then they will help connect our team members to in-network options through the medical plan. We've also refined our medical plan to better align with benchmarks on that out-of-network care, and our fraud, waste, and abuse provider will continue to look at claim anomalies in this area. We are really looking forward to implementing a center of excellence for substance use disorder treatment. Our COE program has always been and will likely always remain voluntary, so we don't necessarily have off-the-charts usage in this, but we want to make sure we make it easy for employees to access care and make sure it's quality. So this will also be a natural referral source for us from our EAP into where we know employees will be cared for well. And although it's early, we're starting to see signals that these enhancements have had a positive impact. We've been working for a long time on how to reach our frontline employees, and that's something that we talk about a lot in here. I think we talk about trying to reach all employees, whether they're at a computer or they're in a factory, but I think the frontline employees are ones that we want to make sure we can get to, and it's not always easy. I can't tell you we've solved it. I can't even tell you that we have satisfactory distribution of our allies at all our sites yet. We're going to get there. But we've seen this program make a difference, and we know we're reaching more of those frontline employees. Just a few notes about this program. It was a grassroots program. The training was developed in-house. We did partner a lot with our EAP, with our benefits team, with our diversity team. to bring it to life. It started as virtual because it was during the pandemic, but we adjusted it to be hosted in our factories in 2024, and we were able to shorten it by an hour or two. We're still at 3 hours. Maybe we'll be able to make it quicker. But what's been really important to us is making sure there's enough time for discussion. We didn't want to just talk to people. I think we still have room to improve there, but we want it to be able to be interactive so that people can be more comfortable with the topic. It's taken off in the UK so much to the point that their team members are asking for more trainings, and the UK now has more mental health allies than the US. And we anticipate expanding this to more sites in the US and another country over the next year and a half, and we're launching a manager version of the training in May. So that wraps up the overview of our mental health resources and priorities. And I've mentioned several times the need to reach frontline employees. And that's why I'm so grateful that my partner Janet is here and she's joined us today, making time out of her really busy schedule, because we couldn't have gotten to where we are today. I remember I said we're not near done, but the progress we've made would not have been possible without Janet and her team.
Have an action step out of your presentation, but
Never done, right?
she did have one summary slide.
Okay, so just a few things, kind of takeaways, and hopefully this all came out through our discussion. Partnering is so important. Find your champions, bring leaders along the journey. Data is important there. People are really ready and evolving. Our leaders and our employees have surprised me in a really good way. The way they want to care for each other, like Janet was talking about. It's really beautiful. Employees connect with other employees, whether it's peer referrals or stories, and prioritize business continuity. We basically say, we'll do what you need. You want training at 11 p.m.? Here we are. We do third shift training at 11 p.m. So prioritize that, and they'll come along with you. So thank you all.
Thank you, guys.
Thank
Thank you
you.
so much. Fantastic. So I love it when these sessions all kind of build on each other. So many of the key takeaways from our presenters earlier in the day, you get to see how at least one company is pulling all of it together. So we are going to take a few minutes here collectively to talk to your table mates about some of the key thoughts that you've heard throughout the day that are maybe, putting some gears in motion in your mind. What are you recognizing that may be something you want to stop doing, maybe something you want to start doing, and something you want to strengthen. So maybe you're doing it, but you need to put more resources and effort into it. So if you could, there's some little notepads on your tables. Write down a couple of the key thoughts that your table mates are sharing. Somebody designate a note taker, and we can come by and gather these. We'll come back together and just ask for maybe 2 or 3 of you to share some thoughts before we move on to our next presenter. So meet your table mates, introduce yourself, and have a little conversation. Thanks. Okay, so looking for 2 or 3 volunteers who would be willing to share something you've talked about at your table. Anyone?
Got it.
Anybody from this table?
That's perfect. So these guys.
So my other question is, mine's being fixed to the.
No. Okay, we have one brave. So we're gonna just think about, okay, we got another volunteer, so maybe one more. And you are Samantha.
Okay, we're kind of cheating here because I'm a vendor. So leave it to the salesperson to grab the mic. But one thing that we talked about is, oh. I could have sang too. It's okay. One thing that we talked about is that our employer at the table is out to bid right now in an RFP for their broker, and the transparency of your brokerage in the data that they're providing, but also the commissions that they're taking. So transparency was kind of a key thing, especially in going out to bid, but then also team members hiring your team, your support, et cetera. So transparency and accountability.
I'm Laurel Pickering with the Gateway Business Health Coalition, and I have two of my employers here, plus an employer friend. And we talked about two main things. One is this idea of defining the outcome before the intervention. I think we're so quick to rush into like, oh, we have to do this program because we have a mental health issue, but really being concrete on what are you looking to accomplish and what is the end goal. And then we spent more time talking about the matching of the patient with the therapist who can do the best for that patient. And I know those of us are participating tomorrow, we'll learn more about this, but how right now it's on gender and race, or what is their specialty? Is it LGBTQ? Is it depression? Is it family issues? And that doesn't really get out the outcome eventually. And Amy talked about in their on-site clinics, they have on-site counselors, and they are trying to get at this by giving a survey to all of their employees that go through the counseling on site to ask like basically what changed for them. And they're in the process of evaluating sort of pre and post, and they're just kind of creating it themselves with their provider. But I know they're looking forward to learning more tomorrow on how to enhance that. So.
Okay, anyone else want to share any other thoughts? No? Okay. So we're going to get started a few minutes early with this weather, maybe get you on the road home a little bit earlier. And I'm going to hand it over to Mark for our next introduction.
Good afternoon, everyone. Mark Flager. I lead membership development and strategic partnerships with the Midwest Business Group on Health, and thrilled to introduce you to our friend, MBGH's good friend, Ian Shea. Ian and I have worked together for years, and he's been connected to MBGH in different ways over that time. What's exciting is that this is the first time we're formally collaborating as thought partners around strategic cultural well-being. And I'm not going to steal his thunder about what we worked on here, but a little bit about Ian. He's the founder and CEO of I Am Human, where he works with organizations across healthcare, financial services, education, law, and public safety, helping leadership teams translate well-being from an idea into something that actually shows up in culture. His work's been nationally recognized, including through the One Mind Solace Award, where he serves on the board for the American Association for Suicidology. So with that, Ian, thank you for joining us.
Yeah, thank you very much. And I'll just start by sharing my practice to keep myself quote unquote stable. Every morning I wake up and I pray and meditate for about 20-25 minutes. And then after that, I have a gratitude journal. So I write always 5 things I'm thankful for. And then I make 3 requests of God or spirit. And what I started doing recently is I sign every entry. You know what? I didn't turn this on. I've got this on. I sign. Can you guys hear me okay? No. I sign every entry at the end, love Ian, right? So I write letters to my girlfriend, my mom, my dad, my siblings, and I write love Ian. And I'd never done that to myself. And it was just a moment of pausing and showing myself self-love. And we're going to talk about that a little bit today. As Mark said, thank you for that kind introduction. My name's Ian Shea. I'm the founder and CEO of I Am Human. I Am Human is a cultural design firm, and we work with organizations to help them design world-class well-being strategies. And I'd absolutely love to thank Cheryl, Mark, Paula, and the entire team for offering this pilot, which turned out to be quite valuable. I'm really excited to report against that. And if there's one idea that I'd like everyone to walk away with today, and we've heard this throughout the day, it's that well-being does not scale through programs, it scales through culture. So a bit of background on how this pilot came together. Mark and I have been talking together for about the last year. And one of the things I was hearing from my clients is that when we offer webinars or workshops or we do leadership retreats, they would say the content's excellent, but we need more than just inspiration. We need something that we can implement when we go back on a Monday. And they started using the words playbook, something that's actionable. The second thing that came up was in and around community. We were finding that within organizations, a lot of the leaders that we would speak to were all individually doing their own cultural initiatives, and they wanted a community to share ideas with, ideate, lessons learned, challenges. And the hidden benefit of that, which we didn't realize at the time, was it would start to remove silos. So it was a need for community. In my discussions with Mark, Mark said, our members have a need for Playbook and we have a need for community. So we launched this pilot. That was the birth of this program, which we launched in January. And we had roughly 18 participate, leaders from all over the United States, some of whom were MBGH members, some of whom were MBGH prospects. And we did 2 sessions, one over lunchtime about 2 weeks ago, and subsequently another hour. And today I'm going to report on that. But before I do that, what I'd like to do is just share with you how this work came to be for me. I grew up outside New York City in a town called Rye, New York, into an Irish Catholic family. I'm the eldest of 5. That's me on the right. And I share the eldest of 5 because as the eldest, I had a lot more time with my grandma. My grandma and I were super close. That's grandma on the right. She was lively, she was vivacious, she was loving, she was caring, and we had a lot of time together. When I was 9, that's the first time I heard the word depression. And I heard in the context of mom and dad speaking to grandma out in the front porch and saying, Grandma Alice, you have depression. And that was the time when grandpa passed away. And what we didn't realize at the time was how much an emotional support grandpa was for grandma. Sometimes when they visit us from Queens, they would always blame them being late on traffic. They would be hours late. And what we later found out was that grandpa was driving her around our block dozens of times just to get her spirits up to be with us. So the version I saw was always positive, lively, vivacious. And when he was gone, that version was gone. And that really left an imprint on me in terms of the impact depression can have on someone. And I also, growing up spiritual, growing up Catholic, I knew I didn't have that card. And it was that moment that really planted the seed on the impact emotions have on well-being. And later in life, I would come to realize that very same impact is what organizations have on well-being. Professionally, as a little kid, I'd always wanted to start businesses. Always had a little knack for it. And that's something that I wanted to do when I was ready in the future. So I structured my career to be a better founder when that day came. I started off in investment banking. And one of my observations culturally, and mind you, I didn't have the words that I have now, but there was just an observation that there was something missing in the culture for me to explore that emotional curiosity that I had, that need for emotional support, that need for emotional growth. Again, I didn't have the words, but it was a feeling. I then moved from investment banking in New York City out to California, which is where I live now in San Francisco. And I ran a tech company for the better part of 15 years, and I sold it to DirecTV. And even in an environment that's seemingly more progressive, even as a leader, I noticed there was something missing culturally. There was no space for Ian to explore his emotional curiosity, his emotional need for support, his emotional need for growth. And again, it was just in the nascency of my understanding. I felt ready to start my first business, the predecessor to I Am Human. Think Masterclass before Masterclass. Got that business off the ground. We raised about $3 million. We're about to raise our next round of $5 million. Things were humming along reasonably well. And I remember it like it was yesterday. It was 5 o'clock on a Friday afternoon. I'm supposed to fly from San Francisco to New York to sign our Series B. Business partner calls me up. Board calls me up shortly thereafter, and they were taking the business from me. They just stole it. And I was left completely high and dry. And so for me, that was the first time personally that I truly had to connect all that emotional curiosity that I had to myself, because I really needed healing. And I had to rewire my understanding of depression, because my wiring at that point in time was grandma. Grandma Alice was clinically depressed. Ian wasn't. Why would Ian spend any time on this? And in that, and in my healing, getting my confidence back, getting my self-esteem back, letting go of a lot of the shame I had, having more grace with myself, I spent time connecting the dots on what was missing, putting language to it, putting language to how important emotional well-being is to me. And I started to talk to companies. And companies said, we could really use someone like you with operating background to help us think more clearly on how our culture is impacting the overall emotional well-being and operational health of our employees. And we created a methodology. Most organizations try to start with strategy. We start with the human piece first, and we quite frankly think it's the most critical. So from the human piece, that's where we notice a shift happens. When you think of the human piece, it's about listening, it's about co-creation, it's about psychological safety, vulnerability, and belonging. And ultimately what that does is it puts people in a space where they start to trust more what the organization's doing. And it's that piece that fuels strategy. And what I'm going to walk you through is exactly what we walk through with the cohort in terms of giving them the arc of how to think about culture differently, how to think about it beyond just a program. So the first phase, as you notice, is life moments. We all have life moments. Think of a life moment as caring for an elderly parent. Think of a life moment as life after divorce. Think of a life moment as moving your family cross country. I was talking to a friend this morning via text, and I sat next to a woman from the National Kidney Association. My friend's going in for a biopsy, and he's got kidney failure. That's a massive life moment for him. And what we found in building an emotional map for an organization is what it does is as people start to share their own life moments, what it does is it really starts to build connection and empathy within a particular room. So if I know that there are other people in this room going through something similar to me, I start feeling less alone. I slowly stop beating myself up. Maybe I'm thinking I've got too much anxiety, or maybe I'm not handling it in the right way. And so here are some of the life moments that were shared by our cohort. One around a father diagnosed with pancreatic cancer. Becoming part of the sandwich generation. I think that was a little bit more consistent for this particular cohort. The death of a spouse after a stem cell transplant. Leaving a CEO role, navigating what comes next. Imposter syndrome. I think everyone on that call had imposter syndrome. Feelings of being lost, scared, uncertain. And these were leaders. These were leaders of thousands, if not tens of thousands of people. Who would be there to care for me? For us, who will be there to care for us one day? And what psychologists say is 85% of managing emotions is just naming them. And an important pillar of building a world-class well-being strategy is creating a lexicon within your organization. Like, how are people actually articulating their own well-being? How are people articulating their life moments? Because that becomes incredibly instrumental in your communications. And when people share their life moments, they stop to name what they are carrying. And one of the things we found is it's incredibly cathartic. When we used to start this exercise, we would distribute pieces of paper for people to write down, and then we'd redistribute them so people were reading them anonymously, and people would scribble real quick, right? And then they'd be done. I would say in the last 6 to 9 months, on average, people are spending 3 to 5 minutes writing much longer. And I think what that indicates to me is there is a yearning for these types of spaces. And the last place they're thinking they're going to see them is within the organization. And that's where that shift begins. So what I'd like to do for one moment is just give you the opportunity to experience what the cohort experiences. I'd ask you to think about maybe a life moment that you're experiencing. Could be something at home, in your body, or something you're quietly carrying alongside your work. And we'll pull up the Slido poll. We'll just take a few minutes just to see, and we'll start to build a bit of an emotional map for this room. Aging widowed parent. Learning to have autism as an adult. Disconnected sibling. That's coming up more and more disconnected child. Health challenges. Father fell and broke a hip. My mom just was diagnosed with Alzheimer's. Laid off partner. Becoming a parent and balancing work and home duties. Dad has stage 4 cancer. Chronic pain. So imagine doing this in a room with your own department. And one of the gateways we found, a lot of people ask, how do we get leadership support? How do we get leadership buy-in? You have to make it relatable to them. And of the list that we just went through, I guarantee you it's safe to say greater than 50% of your leaders will experience something along those lines. And usually what we have found is we get a leader to identify with a particular life moment and get behind it. And that leader may say, I experienced that in the past and I didn't share it. I didn't talk about it. I didn't say anything. And another thing that we heard today is having people share their stories. With one of our clients, we had a leader share their story about caring for an elderly parent. And she thought, she's a leader. She thought that the only time you engage in benefits is when it's a code red. So she almost felt that her engaging with benefits was taxing, unduly taxing, or taking away from the company. She had a friend, one of her colleagues, share that, did you know Bright Horizons also offers adult care? She had no idea, and she was at dire straits. She leveraged that benefit of Bright Horizons to take care of her aging parent, and then she became a spokesperson for it. So there was a bit of, so the life moment can be, because it becomes so personal, can be a gateway into getting leadership support. And what you just experienced is what happens in organizations when space is created for people to name what they're carrying. And then usually what happens is the next interesting step follows, which is people begin to ask, how are they actually taking care of themselves? And this is now bifurcated into two areas. We call this our well-being calibration because we kind of want to know where people are at in their own well-being journey. How are you taking care of yourself? We just named all the life moments that we're going through. What are some of the practices that you're using? What are some of the tools that you're using? We find, and I've done close to 1,000 of these. There's never a session that I attend that I don't learn something new about my own well-being, or I don't learn a new technique. And usually you can send out, as benefits providers, you can send out all sorts of suggestions, but it's much easier when it's harvested from your peers who have the same work schedule or who have the same life pressures. In this particular cohort, morning walks, running, sunlight, gratitude journaling, which I just shared, prayer and meditation. We heard this earlier. We're hearing more and more of an appetite for spaces around spirituality, which we'll talk about in a little bit. Whereas 2 years ago, if I had used that word, there would have been consequences. And now I have people coming up saying, I'm so glad that this organization is just acknowledging that spirituality matters within one's well-being. Therapy, asking for help. There's a lot that's very profound in there because asking for help is coming from leaders. So what that is telling us is that leaders are demonstrating their ability to ask for help. Setting limits. We talked about this earlier as well, boundary setting. I forget who said it, but that was one that was surfaced. And the last one, and this was in no particular order, but showing myself grace, that's a big one. Especially in organizations, especially amongst organizations of high performers, and allowing rest, right? The biggest thing is that we don't see leaders taking time for rest. The next segue is we've already created a space where people feel that the organization's listening, they're caring, they want to get to know. Maybe you're a leader, they want to get to know that individual, asking about how they're taking care of themselves. And then we shift into culture visioning. And Great Places to Work recently came out with a study that said some of the critical components to building world-class cultures of emotional well-being is asking employees what they want. But you can't just ask, and I'll show you why. You can't just ask an employee what they want on a survey. You're just not going to get this. You can, but you're just not going to get the richness of information. You almost have to prime them a bit, remove some of the walls of distrust, some of the walls of fear, and then they can really lean in and start to share. So what this cohort shared was C-suite leaders taking PTO openly and talking about it. Leaders sharing their own stories and life moments. And if I had to give you one piece of guidance, I think that's the holy grail into getting leadership support because they can really become very empathetic and it starts to humanize them. Creating safety for people to share what they're going through. This is what we're starting to model here. A PTO buddy system, so people actually use their benefits. I'll give you a little bit of background there. One of our clients had unlimited PTO, a large pharmaceutical company, and they were scratching their heads as to why no one was using them, right? Nobody was using PTO. In a session like this, after people felt safe, someone suggested, could we have a PTO buddy system? Nobody knew what that was. A PTO buddy system, explain that. So the way they explained it was, Ian has so much anxiety taking PTO because that Monday, that Tuesday, and that Wednesday are going to absolutely suck. So therefore, I don't take PTO. That didn't come up in a survey. That didn't come up in any questioning. And then the person said, but if I knew Cheryl was there Monday, Tuesday, and Wednesday, just to help with Ian's kind of onboarding and re-ramping, we'd be more apt to take PTO. So We implemented that. They implemented that. And what does that show? That shows several things. One, the utilization went up, but more importantly, employees started to feel like, wow, we actually have a part in this culture creation thing. We actually feel more tied to it. Pet bereavement, that was fantastic. I'd never heard of this, but adding pet bereavement to the employee manual, and that was Jessica Brooks. Like that was brilliant. I know everyone on that call took that to heart. One big theme came up, moving well-being. Really what they were saying here was stop calling well-being a program, embed it into daily culture. And that's nuanced, but that's a theme that came out. Prayer, meditation gatherings open across all faith traditions. I thought this was super interesting. Once a month, they set up an hour, a volunteer Zoom link. People could join of any faith, non-faith, just to talk about prayer practices for 1 hour. Incredibly successful offering. And oh, by the way, none of these are really going to surface in a survey per se until you get people into that ideation zone. These last two were probably some of the newer themes that I'm seeing in my work. Leadership development as a well-being strategy. I'd never heard it articulated that way. Leadership development as a well-being strategy. And really what's embedded in that is there are a lot of leaders who quite frankly aren't good with people. And they're very scared to admit that. Like Ian gets promoted. Ian's a rock star salesperson, a rock star lawyer, rock star engineer. I don't want to tell my boss that I suck with people because maybe I'm going to get demoted, or maybe something's going to occur that's bad. And so if you can figure out a way to bring in leadership development from a well-being perspective, meaning if I can start to admit that, that helps my growth. And one of the things we did was we worked with a client who 2 of the VPs were downright awful, right? And we just had to get them into a space where they could release some of their insecurities around that. And then we made them look like poster childs. So basically, they were the first ones who waved their hands and saying, I'm so excited to participate in said company's new leadership development program. And it totally shifted the culture in terms of overall growth and well-being. And the last one, professional development as a belonging strategy, is quite similar, but I hadn't heard it that way. And again, if you ask employees what they want, truly, they will tell you if they feel that you're listening and you're going to execute. And one of the things that was said earlier, I couldn't agree more. There's no such thing as survey fatigue. Absolutely no such thing. It's just not action. I think it was inactive fatigue. I forget what the way it was phrased, but I thought that was brilliant. And co-creation is really an engine for engagement. So once we start to see people share their ideas, they're engaged by definition. And then if they start to see those ideas being implemented, engagement starts to go up. So like we did with Life Moments, I'm just going to spend a moment and just start to harvest some of the ideas that may be in this room. If your culture supported well-being in a world-class way, what would that look like? And we'll just take a few moments because I want to keep us on time. I wouldn't be afraid to take time off. Totally agree with that. Follow through on deadlines. Some schedule flexibility for hourly employees. And we also see schedule flexibility for people who just simply work on different schedules. Some people are morning people and some people are not. And just having a little bit of less rigidity around that. It would be inclusive and transparent. It would be uplifting. It would be self-regulated. I love inclusivity and transparency. I'm going to talk about that a little bit. Flexibility. So you notice how flexibility is a bit of a theme that's surfacing in this particular room? And we'll just give it a few more. I see a couple more people typing, but if not, clarity of strategy and priorities, not afraid to ask questions or challenge the status quo. So we're seeing things like flexibility surface in this particular room, transparency, and clarity. Everything we talked about so far is what I call the human work. And the human work is what makes strategy possible. It's the life moments that's all about listening, psychological safety, vulnerability, well-being calibration. You're just trying to get a sense of where your organization is or isn't in their own well-being maturity. Culture visioning, really creating a sense of co-creation that people have an imprint and a mark, can leave a mark on their culture. And then you have to quickly pivot into the strategy side. And we've talked about this earlier. How can you take all that data and put it into a strategic plan that actually makes sense for your organization, that's actually presented in a way that leaders are going to pay attention to, that people can take ownership over said actions, and there's metrics and data. So it's got to be translated as quickly as you can so it moves from a human piece into a business operation piece. And what we find, we've talked about this today, is a lot of organizations are stuck on that traditional side. They're stuck in the program side, the benefit side, the initiatives, the campaigns. And they're not really approaching it from a cultural side, which is listening, right? Again, that Great Places to Work report that came out in, I think it's January or March. Their first thing they mentioned was the importance of listening. Josh Bersin, who's an HR expert, talks about listening as an organizational muscle. Co-creation, leadership behavior, and then designing that into cultural systems. So this is an example of what happens when listening turns into strategy. This is one of our clients. I wanted to pick one in Illinois. Bridgeway is one of Illinois' largest behavioral health providers in the state. And so everything we did from the human side translated into this. So this wasn't Ian's magical map per se. It was everyone in the organization giving their piece of feedback that we then aggregated into something that's measurable, it's strategic, it has business rigor, and that people started paying attention to. And so I'm just going to walk you through a few. We don't have to walk through all these, but up on the upper left, the biggest thing that came out with respect to culture was communications. Like, I would say over 50% of the wishes and desires were how can we get better at communicating? Transparency. What did we just say on the slide prior? A lot of people were talking about transparency and communications. Transparency and clarity. And so the comms department, while it's not in HR, the comms department in this particular case is probably the most important driver from a departmental perspective on the well-being success. The other piece, and I think some people mention this, is the power of a culture and engagement committee. That's in the middle. So when you do a lot of these exercises, and I think I spoke to a woman at my table who she said she was a small and mighty team of 4, and yet she has tens of thousands of people that she can lean on. That culture and engagement committee is so critical because those individuals are the ones that are in different departments. They're culture carriers. They're people that look up to, the people that others in the organization look up to, and they become your eyes and ears for the success of these programs. You can kind of like drop little seeds. Is this going to work? Is that not going to work? What are we missing? What are we doing wrong? And that really creates stickiness, within these initiatives. So a wonderful quote came out of our session, which is, programs don't scale well-being, culture does. How many of you have seen well-being initiatives struggle to gain traction? That's the gap that we're trying to close. So a few items to carry with you. Well-being doesn't scale through programs, it scales through culture. I think that's one of the largest themes that came out of today. Listening is one of the most powerful tools leaders have, and a lot of leaders may not be good listeners, and that's okay. Create safety for them to admit that, and then create a path for them to get better at it. Employees will tell you what they need if you create the space to ask. And really, if you flip that on its head, when employees aren't asked and are asked and nothing's happening, that's like a double whammy, right? In terms of taking away inertia from culture growth and culture creation. And when people help design culture, they're more invested in it. It's our belief that every organization is a container for human experience. The question is whether that container is being intentionally designed. And that's the opportunity for employers, for all of us today, to design cultures that truly support the well-being of humans inside them. And with that, I'll open it up to Q&A. I think we've got about 2 minutes-ish for Q&A. And also, this was a pilot. And the pilot, just as a refresh, we did 2 lunchtime sessions, 12 to 1. About 18 people came together. And it was fun, right? It was fun. It was a learning exercise. It was a learning journey. So we're going to do a second pilot in April. So if you have interest or if you'd like to learn more, there's a QR code and we could follow up. And we'll also follow up with information after. So thank you for your time, and I'll open up to Q&A.
I just wanted to comment on how much we appreciate your willingness to do this with our employer members. They have gotten a lot out of it. I've heard a lot of positive feedback from them. It's no cost. So if you're an employer in here, this initiative and the learnings from it have been free to our employer members. And I have to share my favorite quote, and you've heard me say it before. Culture beats strategy for breakfast. Is that it? Culture eats strategy for breakfast. And this has been a great way to end today because it kind of wraps all the pieces together and reminds us that it's not about programs. And we heard that from our first speaker and a few of our other speakers today, and now from you. Excellent. Any questions? Any comments? They loved it. They're just tired.
We got one. But I know it's late in the day. Trust me. I don't know if I'd have any questions. And Claire, just a quick note. Claire Miller and Mike Thompson. My gateway into this whole community is Mike Thompson. Mike Thompson is an advisor, and he took, I would call it, a risk on me very early on, and was instrumental in me getting to where I'm at. He's the reason I know Cheryl. He's the reason I know Claire. So this is also added benefit for me, just to have all the people that are in the room today be here.
I love what you're doing, and it's so wonderful to see how much it's developed and has, I mean, this is amazing. It's you have the full deal now, because I talked to you in, the early days. I may have missed it, but can you share a little bit about, there are some people that would hear what the kinds of things that questions you will be asking, et cetera. And that requires a level of vulnerability that a lot of people are not necessarily comfortable with. So can you share anything about sort of how you overcome that? Because the people that have that reticence are, of course, also probably the people that can most benefit.
Yeah, that's a great question. So we generally don't share those questions ahead of time. And there's a lot of pushback I get from leaders, and I almost have to get their trust. So we'll walk in a room, and a lot of times people will have a snippet as to what we're going to do, but never ask the questions ahead, or don't give the questions ahead of time. When we ask the questions, we're very clear about this. If you don't feel comfortable sharing, that's okay. And we do it anonymously so that we have a way to do it so nobody knows who's sharing, unless, of course, I shared something with you, you told everybody, but for the most part. And so there are people who simply won't answer. And that's okay. And the way we do it is we have a match. So in other words, Claire, you would read someone's in this room, but you wouldn't know who it was. So by the time it gets going, people who didn't answer don't feel left out, because maybe there are two people who didn't answer by the time we get to Mike's table. And so we try and make it as soft as possible, but there is a little rub, because if we gave the questions ahead of time, I don't think it would have the achieved outcome, because there's a shift that happens in the room. There's a catharsis, that happens. Well, I'll be around after and for cocktails, and you have my contact information if you'd like to get a hold of me. Thank you all. Thank you all. Thank you for a wonderful day.
Okay, now we get to the fun part. Are we at the fun part? Okay. First of all, we're going to ask you to please complete the survey. It'll only take you 1 minute. It really gives us great information, and use the polling to do that. I hope today was beneficial and robust and compelling and made you think about things in a new way. We are always here if you have any questions or need anything. And I'm going to invite Paula and Mindy to come up and give away some prizes.
Did you have that? Did you prompt him to do that? It get quiet. So did they pull their phones out? Did we give music to do the evaluation? If you could pull your phones out. You can either click on the polling card or tile or the evaluation tile. Both of those will take you to the quick evaluation. And if you're still on virtually, you can also fill out the evaluation in the mobile app. All right. Let's move on to some prizes. We've got our upcoming educational events. So please check those out on the website or look for the weekly emails. And some prizes that we're giving out today. A TELUS Health goodie bag goes to Andrea Dowdy. Woohoo! A Nike duffel bag. Oh, and I should say, yeah, that was TELUS. A Nike duffel bag that's from Modern Health, and it's probably as big as the winner. It goes to Sue Ferlin. And we have one of Dr. McKinley's books, The Resiliency Quest. That goes to Jason Duhan. And a swag bag from Chase and the Wellbeing Think Tank, which includes a pass to her annual summit, which you can attend in person out in Portland or virtually. So you can do that either way. It's next year. Janet Pajamula. I think I got it right. Woohoo! And lastly, MBGH is giving away a complimentary pass to our 46th annual conference taking place May 5th and 6th. And that goes to Ashton Gibson, who participated virtually. So we will get you the instructions of how you can register for the conference. Ashton is with CAE, U.S. Benefits Analyst. So congratulations, Ashton. And thank you to all of our sponsors for donating prizes. Thank you all for being here. Have a very safe trip home. If you're staying, we have the cocktail reception for Pcori, and then tomorrow we have the Pcori convening. So thank you all so much for your input and your insights and for being here today. Have a great evening.